Hello, everyone. My name is Jennifer Merstorff, and I'm the CEO of the Young Survival Coalition. Welcome to Day 2 of the 2021 YSC Virtual Summit. If you missed last night's amazing talk about sex after cancer, you can still watch it anytime for the next 30 days. It really was awesome. There is still time for your co-survivors to register and attend the summit. We want to ensure that all co-survivors know that YSC is here for them also. And I want to give a special shout out to the international community that's joined us this weekend. I am thrilled that the YSC community continues to grow to include all young adults affected by breast cancer, no matter where they live. But let's start this morning. I have the honor of welcoming a very important woman in my life to lead us in the morning meditation, Kristen Westbrook. I met Kristen at my very first YSC face-to-face meeting back in 2010. We became instant friends and have been by each other's side throughout both of our breast cancer journeys for 11 years. Kristen is the founder of Calm City, New York's first mobile meditation studio. She started this company herself and was driven by her passion that all people should have an opportunity to have a quiet place to meditate, even in the middle of New York City. As if this first company was not enough, in 2020, she co-founded Mindset to continue her personal mission to empower people to be happier and healthier. Kristen knows firsthand the power of meditation because she does it every day since 2001. I am honored to introduce all of you to Kristen Westbrook.
Welcome to our 10-minute meditation session. Find your comfortable seat. You're sitting in an office chair or a dining room chair. Your spine is straight. Your feet are touching the floor. Your legs are uncrossed. Feel as if you're being pulled toward the sky by the crown of your head. You can put your right hand in your left palm or put your hands on your thighs, whatever feels comfortable. Go ahead and close your eyes if that feels good. If you're feeling sleepy, you can gaze at a spot on the floor or the desk in front of you. And let's take a nice deep breath in through the nose and out through the mouth. So in through the nose and out through the mouth. Let's do that again, in through the nose and out through the mouth. And then just return to your natural, easy breathing. Beginning to bring your focused awareness inward. Allowing any outward focus, any activity or sounds to just fall away into the background as we begin to explore sensations, thoughts, and emotions. As we allow the breath to connect the body and the mind here in this present moment. So notice if you feel any tension or holding in the body, sometimes in the shoulders, in the forehead, the jaw, the tongue, belly. And if you identify any tension or holding, see if you can release it and allow it to flow out through the soles of your feet. So identifying any tension or holding, releasing and allowing it to flow out through the soles of the feet. And just moving through the body, allowing the body to relax. Relaxing the feet, the shins, thighs. Feeling the weight of your body in the seat. Allowing the seat to support you. Relaxing your hips and your low back. Moving up the spine to the middle back, the upper back, the shoulder blades, the shoulders. And just allowing the shoulders to fall away from the ears. And perhaps you feel a relaxed sensation washing over your shoulders and down your back, down your arms, your upper arms, your elbows, your forearms, down into your hands and your fingertips. Just simply observing our human experience here in this present moment. Taking the time to connect with our inner life so that we can truly be here for ourselves. Allowing each moment to unfold without judgment. Relaxing and releasing all of the muscles in the face. Noticing a relaxed sensation washing over the top of your head, down the back of your head and down the back of your neck. Begin to turn your awareness and your attention to your natural, easy breathing. No need to manipulate the breath in any way. You just want to be really curious about the sensation of breathing. Noticing little details about the breath. How it feels as the air passes the tip of your nose, on its way into the nostrils and down into the lungs. You may notice the temperature of the air as it moves into your nostrils. And the difference in the temperature as it moves out of your body. And see if you can rest your attention somewhere on the breath. Perhaps at the tip of the nose, the rise and fall of the belly. And just allow your attention to rest there, just like a little bird on a branch. notice thoughts pulling you in different directions away from your attention. Thoughts wandering down a path into the future or a path back into the past. And if you notice, you're welcome to just simply shift your awareness, to choose to redirect your focus back to the sensation of breathing. No need to push the thoughts away. Perfectly normal and natural. So we'll sit in silence for a minute or so. And begin to bring your awareness back to your fingers and toes. And you can move your body in any way that feels good, rolling your shoulders up and back. Whenever you're ready, take your time and gently open your eyes. I like to stretch and smile. So thank you so much for practicing with me today. Have a wonderful day.
Greetings. I'm Desiree Walker, for those of you who are new to the YSC family, and I am the board president. I'd like to thank Kristen for the morning meditation, and I hope many of you enjoyed that session. On behalf of the board, I'd like to welcome you to the summit and today's general session. We're glad you're joining us for this special weekend to focus on you, whether you've been diagnosed or you're supporting someone who has been. I like to identify as a 2-time breast cancer victor because I'm grateful for each day that I can live life fully. When I began my breast cancer journey almost 2 decades ago, there wasn't much conversation or focus on young adults. And there definitely wasn't a YSC summit. So I look forward to attending this conference, even at this stage of my survivorship. I will truly miss seeing familiar faces, reconnecting with others, and meeting our first time attendees. But I'm thrilled we were able to come together. This has been a challenging time for all of us. But I just want to share with you a quote from the late Cicely Tyson. Challenges make you discover things about yourself that you never really knew. And although we've been through an extraordinary time, YSC has continued to support you on your breast cancer journey, and we invite you to join us and spread the word in your community and beyond that we are here to ensure every young adult diagnosed with breast cancer receives the unique support needed. And as we've said in our theme this year, we're in this together. I'm excited about today's general session, Ask the Expert, Hot Button Breast Cancer Updates. Before I introduce the panel, let me tell you about the format for the session. I will kick off the session with questions to allow you time to type your questions into the chat box. And then we will turn over to answering as many of your questions as we can. Without further ado, I'd like to welcome to our virtual stage and briefly introduce our distinguished panel. Please note that the full bios for each of our doctors are on the summit's homepage. I'd like to introduce you to Dr. Minetta Liu, who is a breast medical oncologist and translational researcher at the Mayo Clinic in Rochester, Minnesota. I'd also like to introduce you to Dr. Mariana Chavez McGregor of MD Anderson Cancer Center in Houston. And she's a medical oncologist and researcher with a clinical practice dedicated to the care of patients with breast cancer. We're also joined by Dr. Lisa A. Newman, who is a surgical oncologist clinically focused on breast cancer management. She oversees the breast program for the Weill Cornell Medicine New York Presbyterian Hospital Network in New York City. And I'd also like to introduce Dr. Mark Graham, who serves as an Associate Director of Clinical Research at the Stanford Comprehensive Cancer Institute, and he's a director of the Breast Oncology Program at Stanford in Palo Alto, California. Welcome.
Thank you.
Happy to be with you.
So I'd like to just start off because, as we all know, we hear COVID at every second of the day. And so I'd like to start off by asking each of you to just share with the audience, what is the most important thing you want them to know about COVID-19 as a breast cancer survivor or thriver and the vaccine? And what are some of the biggest misconceptions? So I'm going to start it off with Dr. Liu.
Sure. Thank you, Desiree. So I tell everyone cancer sucks more than COVID. So we've learned a lot from COVID, but I think many of us have continued to focus on the care of our patients. We had to sort of pivot around things to, enter the world of virtual care to be able to provide the care that we need for patients and not to miss a step. With respect to the vaccine, I encourage everyone to get the vaccine. To date, it appears to be safe from what we know. To get it. It's worse than actually having COVID-19 and its related complications. We're learning about timing of it relative to administering different agents or timing of surgery and radiation. There's still a lot to learn, but it is, I think, again, safe to proceed.
Thank you. Dr. Chavez McGregor?
Well, thank you so much for the invitation. I will echo the main message that it is very important to discuss with providers the possibility of being vaccinated. Now, vaccines are widely available. I recommend the vaccine to my patients, and not only to them, but have a conversation about having vaccine on their loved ones that they interact with, because it's another way of protecting our patients. I think another important message is something that we all live, everybody that was in healthcare experienced a dramatic change. And we had to experience delays and adjustments of treatments as we were getting used to this pandemic. As a consequence of that, I think that we're very healthy women that delay their screening mammograms. So all of you in the audience is very engaged members of the community. I think another important message is to invite friends, family members, colleagues to come back to the healthcare system, to the doctors, to do all those tests that for many patients are over a year due, and that can save lives. So let's get back to our healthcare system, back to all those do evaluations and get the vaccine.
Thank you. Dr. Newman?
Hi. Thanks so much, Desiree. It's a pleasure and an honor to be a part of this program. So I would definitely echo the comments made by both Mariana and Minetta. My own area of research focuses heavily on breast cancer disparities, and we were certainly heartbroken to see the horrendous excess severity of COVID in African American and other underrepresented minority communities. And in terms of cancer, the consequences are far worse than what we saw during COVID. the shutdown of all our screening practices and the impact of COVID on the economy has been disproportionately worse on underrepresented minority communities. And so tragically, we're only now starting to see the effects of the COVID pandemic on cancer, in particular breast cancer disparities, and a worsening of the stage distribution on breast cancer, because the underrepresented minorities were hit worse by the recession. And so our underrepresented minority communities are the women that are still not yet coming back into screening. And we have to partner heavily with our advocacy organizations to make sure that our women, our underrepresented minority women in particular, do get that vaccine, and that they do understand that it is indeed safe to come back in and to get screened for breast cancer. And if they have any breast abnormalities, to get those breast abnormalities evaluated. I've been very heartened by the wonderful partnerships that have grown between the COVID epidemiology public health community and the breast cancer advocacy community in getting the word out, disseminating information about the safety of the vaccine. So it's been in some ways strengthening partnerships, but we have a long way to go. The disparities are definitely getting worse in terms of breast cancer.
Thank you. Dr. Pegram?
You know, at the height of the pandemic, we implemented a number of procedures to try to mitigate against viral transmission in the cancer center at my institution. But I'm really pleased to say that in the past 6 to 9 months, we've come back full on back in business as usual with no impact of COVID at this point at our centers. So I'm very pleased to say that we have a very high vaccination rate amongst our patients. They still get tested on a regular frequency if they have infusions in the infusion center, for example. We've relaxed having family members and visitors come along with patients to clinic visits and to their infusions. Everyone still wears masks 100% of the time, of course, inside the facility. But I'm pleased to say that in terms of screening, early detection, imaging, the ORs are completely at capacity. The infusion centers are humming. We're completely wide open back in business as if it never happened. But we did live through a struggle, early last year where we had a lot of transmission mitigation factors that we put in place that were rather severe. But fortunately, we're past that, and that's what's best for our patients. I can't amplify enough what my colleagues have mentioned about vaccinations essential. We have a very high vaccination rate in the Bay Area, and so that's served us well. And our viral detection rates now are exceedingly low.
Thank you. And so as a follow-up, I just wanted to ask this particular question. We do know that some breast cancer treatments do increase your risk for blood clots. And so individuals on those type of treatments, when they're potentially considering the news and the risks that we've heard with the J&J or the Johnson & Johnson vaccine, what should they consider thinking about? What would you tell them? Any of you can speak to that.
The incidence of severe thrombosis for the J&J vaccine was very rare, and it's really limited to particular subsets of patients, younger women in particular. But for the vast majority of patients, the risk is so low, your risk of thrombosis from other interventions are arguably much higher. Really, chemotherapy and drugs like tamoxifen, those risks are higher arguably than the J&J vaccine. That said, up until just 2 or 3 weeks ago, I would argue, we always told our patients, just take the first available vaccine you can possibly get, because that's the most important thing to save lives, is to get as many people vaccinated as quickly as possible. Now, there are not long lines at vaccination centers, and a discriminating patient has a choice, frankly. So you can do a little bit of searching around your community and pick and choose between the vaccines if you want to avoid the J&J vaccine. That's your purview, and I would have no problem recommending that, particularly a young patient who's on adjuvant tamoxifen, for example. If you have an alternative, why not use it? And now there aren't long lines waiting to get particular vaccines.
Thank you. Does anyone want to add anything to that?
I'll just add that just like any other medication, it's a consideration between patients and their providers about what their risks might be, because there's some risks that could be mitigated and others that might not be able to, be avoided. And it's just considering everything in total and helping patients to come up with individual decisions. Because as Mark gratefully raises, is that we're not having some choice about access to the various vaccines.
Yeah. And I would also specify in terms of mitigating risk, it's important for people to remember to get out there and exercise. During the COVID shutdown, I think all of us are guilty of not exercising as much as we should for our health and not necessarily following the best diet. It's time to get back into healthy nutrition practices, exercise, walking, fresh air. Those are all ways to prevent the risk of deep vein thrombosis and just stay overall healthier.
So for this next question, I'm going to start with Dr. Chavez-McGregor, and then I'll call on each of you. So the question is, what are you most excited about right now in breast cancer research?
There's something I'm excited about. Many things. I think there are incredibly talented scientists and clinicians all over the world, like working on many very interesting topics. I think the world of immunotherapy, it's incredibly exciting. I think the further understanding of the differences between each one of the breast cancer subtypes so we can treat them differently, it's fascinating. But something that I am very excited about is the fact that we as a community are starting to have some of the difficult conversations. And I love that, right? I think we're starting to have with advocacy groups, with patients, among ourselves, discussions about race, about inequity, about access to healthcare. We are having the difficult conversations, and we're not going to solve it in a talk, but I think that's bringing some obvious problems. So similar to Dr. Newman, I work in these parties. I'm committed to that. I'm an ethnic minority myself, and I just think we need to bring to the forefront this idea that we need the best possible treatments, but we need them for everybody. So I think those things that we're doing, that we're willing to have to hear the uncomfortable truth, I think as patients can make them demand more from us, and as providers and scientists, we may be able to deliver better solutions for our patients. But in the big field, excited about many things, because it's a very exciting field and very talented people working in many different areas.
Thank you. Dr. Newman.
Yeah, so I totally, everything that Mariana said just now completely resonates with me. While it was tragic to see the disproportionate severity of COVID on the African American and Hispanic, Latina American community, and all of that happening on top of the horrendous atrocities that we saw with the George Floyd murders and other awful events at the hands of law enforcement, with people of color being treated abusively. All of this did serve to make us acutely confront the issues of systemic racism, and we are confronting it on all levels. We're confronting it in the criminal justice system, we're confronting it in the cancer spectrum, and it is forcing us to pay more attention to health equity. We've known of these disparities in terms of the disproportionate burden of cancer in communities of color for a long time, but in the wake of the COVID pandemic, we are now forcing the entire country to handle it much more aggressively. So that is very, very exciting in terms of driving novel research platforms. We're starting to learn more about the genetics of a breast cancer associated with ancestral backgrounds, and those types of germline genetic patterns has an impact on not only the type of breast cancer that you're more likely to be diagnosed with. We've all known for a long time now that African American women are more likely to have the biologically aggressive triple negative breast cancers. And by doing these genetic ancestry studies, We're going to learn more about the inflammatory microenvironment of breast cancer. We're going to learn more about treatment. We're going to learn more about how precision medicine can be leveraged more appropriately for our diverse populations globally. So there is a lot going on, and we're also making sure that a lot of this work is done by a more diverse workforce. This is a huge issue that we have to tackle, but very important. We definitely need more diversity in the oncology and clinical trials workforce, but we're getting there.
Thank you. Dr. Pegram.
Well, thanks for asking, Desiree. I'm super excited by the application of molecular diagnostics now to safely avoid unnecessary chemotherapy and all intended toxicity and expense and headache to huge groups of patients now. In the wake of the TAILOR-X trial, there's a huge group of patients with ER-positive, newly diagnosed early-stage breast cancer with intermediate recurrence scores that we now know do not need chemotherapy, or they don't benefit it for sure. And in the wake of the responder trial, we even have lymph node positive, ER-positive, newly diagnosed breast cancers. A huge fraction of those patients now, we understand that we do not have any benefit from chemotherapy in those patients as well. So this is just an enormous gain in terms of the application of the new molecular tools that have been brought to bear to the breast cancer problem. And now we've known for decades that we're over-treating so many patients with chemotherapy, especially with node-negative disease, but even low-risk node-positive disease with just a few nodes. And we finally have the molecular tools to identify those patients and get them off the table in terms of chemo. That's a huge, huge win for the community. I'm really excited about the integration of immuno-oncology and breast cancer, that we're still just scratching the surface of that. We do not understand well how to best use these drugs yet, and there are more drugs in development. We need better tools to understand the complexities of the immune repertoires inside tumors. There are new technologies, some of which have been invented recently at my institution at Stanford. For example, multiplex ion beam detection and Codex, barcode-coded antibody technologies for diagnosis, can now measure the entire complex immune repertoire inside the tumor at the time of diagnosis and following treatment. And I think that's the granularity we're going to need to understand how to best integrate immuno-oncology approaches. I'm also very excited about novel antibody drug conjugate targets like TROP2 for triple-negative disease. We now have bispecific HER2 antibody drug conjugates that are in clinical trials right now. We have novel antibody drug conjugate payloads, TDM1 and trastuzumab deruxtecan and sacituzumab govitecan all have chemo payloads. But now for the first time at Stanford, we have an antibody drug conjugate targeting HER2, but it has an immunologic payload to augment immune action against the tumor. By conjugating, instead of a chemo drug, we conjugate a toll-like receptor 7 and 8 agonist to stimulate an immune response against the cancer. So that's super exciting. We have the advent of engineered antibodies now that have greater potential to elicit immune responses. Margetuximab is the first in class of that example. Again, another HER2 targeted antibody. And finally, we're going to see at ASCO the introduction of PARP inhibition for BRCA mutant early stage breast cancers. That's going to be really exciting data and may well be practice changing. So a lot is going on. The pace of discovery has never been faster. There have never been so many new drugs approved for breast cancer in such a short period of time in the past 2 years. And I don't see that pace changing anytime soon. So this is a really exciting time to be involved in research and in clinical care.
Wow. It is. You're getting me excited. I'm like, I don't think we have enough time to talk about all what you've just touched on.
Other than that, there's not that much going on. Other than that.
But wow. Dr. Liu?
What else is there to say after these three? I'll be brief because I know there are a lot more questions and I don't want to be repetitive. I will, for me, it's all about precision oncology, precision medicine, and bringing that to cancer care. And the beauty of the fact that we can bring technologies to the clinic and that the clinic is bringing it back so that we can improve those technologies. And it's happening in real time now. It's not like 5 years until some new platform's developed. We can't keep up with it. A lot of the work that I do is in the liquid biopsy space. And, my hope is that although we will always need tissue, that we will need biopsies less, and we'll be able to learn a lot serially by sampling the blood repeatedly. And that will help us to escalate or de-escalate care appropriately. We treat patients, unfortunately, as part of a population, but we really need to get down to the level of treating the person who's sitting in front of us at the time they're sitting in front of us. And I really do believe that the blood space will help us to get there.
Thank you. So, triple negative breast cancer has come up in a few responses. And I know, Dr. Newman, you've done a lot of research as well in this area. So I just want to ask, is there any new treatment for triple negative breast cancer? And are there any studies that are going into clinical practice for both early stage as well as metastatic breast cancer, triple negative breast cancer?
Well, I will certainly defer to my colleagues in medical oncology to speak specifically about the very, very exciting research and novel directions of immunotherapeutics and precision medicine in addressing triple negative breast cancer. But I would like to make a few comments about some of the work that I've had the honor of being involved in for nearly 2 decades now, with trying to understand the ancestral genetic link between African ancestry and being diagnosed with a biologically aggressive breast cancer. And we've seen this pattern for several decades now, but only in the past 10 to 20 years have we so definitively linked it to the diagnosis of a triple negative breast cancer, because we've come a way in understanding the diversity of breast cancer as a disease and looking at multiple different biomarkers to characterize breast cancer. What our group, based at Weill Cornell Medicine, the International Center for the Study of Breast Cancer Subtypes, what we have been learning in our global efforts to look at the burden of breast cancer in women with African ancestry, not only here in the United States, but also in different regions of Africa, is that there is indeed an association between Western sub-Saharan African ancestry and the likelihood of being diagnosed with triple negative breast cancer. And we have been able to draw a nice line between this association with certain genetic inflammatory markers and germline genetic patterns that are linked to the development of patterns that confer resistance against malaria. That's how some of these patterns developed in Western sub-Saharan Africa. But with the transatlantic slave trade, some of these patterns came across to the United States, and many of these germline genetic patterns we see expressed in African Americans. But because of the shared ancestry between contemporary African Americans and contemporary Western sub-Saharan Africans, these germline genetic markers that have an impact on inflammatory response and the inflammatory microenvironment, they have a downstream impact on the type of breast cancers that are diagnosed. And this includes the risk of developing a triple negative breast cancer. So our group is very excited about some of the work that we've been done to better understand the genetic root causes of certain types of breast cancer, such as triple negative disease.
Thank you for sharing that. And can I ask one of the oncologists to respond to that question?
Sure, I can take it first. Go at it. I think the question, are there new drugs? The answer is yes, and there are many, and some of them are, luckily for us and our patients, FDA approved now. Traditionally, triple negative breast cancers have only been treated with chemotherapy. That has been historically the only tool that we have had to treat them. And since 2018, actually, we started seeing a lot of activity. So now we have, for example, PARP inhibitors, olaparib and talazoparib, approved by the FDA in 2018 to treat patients that harbor a germline BRCA1 or 2 mutations and can have triple negative tumors. Now we have drugs like pembrolizumab and atezolizumab, both of them approved. These are immunotherapy that we combine with chemotherapy in patients with triple negative tumors, only selected tumors, probably roughly about 40% of those. We have to identify the patients that can respond. Now we have also approved the newer drug that Dr. Pigram mentioned, sacituzumab govitecan, that I have used the drug. I've seen extraordinary responses on my patients. Very interestingly, there's a drug, trastuzumab deruxtecan, right? Traditionally, a HER2 positive drug that got approved about a year ago. And in patients that have a little bit of HER2 expression, we're evaluating that. So tumors can be triple negative, and we're evaluating if, because of this small expression of HER2, this drug can be effective. So we have drugs that are available today for patients. And now there's a huge portfolio and a pipeline of many different drugs within these classes, newer versions, or other classes that are being evaluated as a single agent, or also now in combination to revert resistance. So we have studies with PARP inhibitors and immunotherapy. We have all sorts of combinations all around, the world and the country to bring us hopefully more drugs to the clinic. So I think there's a lot of work. Of course, Minette and Mark add on, but super exciting in terms of the tools that today we have to treat our patients.
Desiree, may I add that I'm really excited about the prospects for the future because of the advent of new research technologies that will have application, I believe, to triple negative breast cancer, but to other subtypes of breast cancer as well. One of these is called Cytotrace, and it's a new way using single-cell RNA-seq technology to identify kind of the holy grail of cancer at its fundamental core, and that is cancer stem cells. And now Dr. Mike Clark, Aaron Newman, Gunziger Gulati, Fred Durbis, and others at Stanford have identified new targets on cancer stem cells using this technology. And it looks like some of these targets may well be druggable. So that's something to look forward to in the future, and it may well apply to triple negative breast cancer as well, I predict.
Wow, that's awesome. That's awesome. Well, we have a lot of questions that are coming in relation to tamoxifen. And so I'm going to try to get through to some of those now, because the reality is that being premenopausal, tamoxifen has always been the go-to. And so but it's sometimes challenging. I'll say my own personal experience it was. And so is there any research for a new drug for premenopausal women that could replace tamoxifen on the horizon?
I believe so. I mean, now, for the first time, we're seeing the advent of orally bioavailable, that means a pill, of cousins of fulvestrant that are in that same family of drugs as fulvestrant. That is, those that actually degrade the estrogen receptor protein as their mechanism of action. And now, instead of having to inject like fulvestrant as an intramuscular injection every month, which is not feasible to give in the adjuvant setting, much less for very long in the metastatic setting because of pain and discomfort and sterile abscess formation at the site of injection, et cetera. So now these drugs are in late phases of clinical trials and could be particularly exciting and may well be more efficacious than tamoxifen and could replace it in theory. They're challenged by some toxicities. These drugs are not without toxicities. And some are unique. Some have some lower GI toxicity. Some have some unusual cardiac toxicities like slow heart rate, for example. Some have visual changes like blurriness or streaking of lights, things like that. So some challenges to be sure, but excitement because there are a number of these drugs in development. They have different safety profiles, most of which are pretty clean. So stay tuned on that front.
Thank you for that. I think it goes without saying that, as a cancer patient, survivor, thriver, you're always looking to have a better quality of life. And we know the challenges that, as I said, that can come from tamoxifen. And one of the questions that was posed is that, there's some limited studies out of Italy on the difference with 10 milligrams versus 20 milligrams of tamoxifen. And so they want to know, what do we know about the minimum effective dose, as well as, it's being reported that there are fewer side effects from that. Can any of you speak to that?
I guess I can start and then others can chime in. First, I'll say that tamoxifen is still a good drug. The advantage or the hope in premenopausal women is that we'll have more than just the one choice of tamoxifen. And as Mark nicely outlined, there are certainly drugs in development. And the fallback has always been rendering a premenopausal woman postmenopausal or making her menopausal to open the door to other drugs. With respect to quality of life, the other part of getting women through a course of tamoxifen is the fact that we can do a lot in managing the symptoms, right? Whether they're hot flashes, vaginal irritation, et cetera. So there's a whole science about women's health that I think has helped us in taking care of our premenopausal patients who are on tamoxifen. The dose finding questions about tamoxifen, sometimes 10 milligrams twice a day is better tolerated than 20 milligrams a day. And we actually have data to suggest that it's equally effective. 10 milligrams a day versus 20 milligrams a day, we don't know is equally effective. We do have evidence in pharmacogenomic studies about CYP2D6 testing, recognizing that some patients will metabolize or break down the drug differently than others. We don't know whether or not that should dictate the dosing relative to efficacy in reducing the risk or managing breast cancer. But again, those studies, they're very controversial, those different studies. Certainly less does give you less toxicity, but we don't know if that translates into equal efficacy.
Yeah, I'll echo what Minetta is saying. And I think my message will be that today, the standard dose, it's 20 milligrams per meter square. And even if there's a lot of work on CYP2D6 testing, the guidelines today don't recommend for us as oncologists being testing this routinely. So I think something that is very important is to make sure that there are open channels of communication between patients and providers, so we can hear about the side effects, right? We can hear the main problem is gain weight or fatigue or sleep disturbances or vaginal dryness. So then we can use some of the tools that we have to improve those side effects and maintain adherence, because we know study after study that it is important to take the medication in order to receive the benefits from it. And sometimes that can be challenging.
You know, I've been mystified myself why we don't make better opportunity of tools we have available regarding metabolism of tamoxifen. Tamoxifen is a prodrug, but we can measure the active metabolites, you know, with pharmacokinetic assays in real time. We can measure endoxifen, hydroxytamoxifen. These are easy to get. You can order them in your clinic, and we rarely, you know, apply that. And that would obviate the need even for CYP2D testing, because if you can measure the actual active drugs, then not only would your genotype for CYP2D6 maybe become apparent, but so would concomitant medications that may also share that CYP2D6 pathway, that it might influence the pharmacokinetics of tamoxifen in that individual. So there ought to be ways to have personalized pharmacokinetic measurements of tamoxifen active metabolites and titrate the dose according to the actual levels that you desire, and some of which might mitigate against some toxicities. That's my, you know, twist. And I don't know. I'm sure it's cost. That's the reason we haven't been measuring pharmacokinetics routinely on all subjects. But you know, I think we have to do the right thing for patients, and if it costs a little extra, particularly for patients who may be struggling with toxicities, then we ought to make use of the technology that can be brought to bear on the problem.
I agree. But I'm going to throw out this other question that just came in, which is an interesting one. Is there any research on the horizon for premenopausal women on the cusp of menopause?
I guess that the quandary in that setting, which many women will fall into, whether it's after chemotherapy and experiencing chemotherapy-related amenorrhea, and then, or being of an age where naturally while you're on tamoxifen, you might then be transitioning, is the development of some testing so that we can know for sure when a woman has gone into menopause, because it's so nebulous. I mean, in real life, take breast cancer, tamoxifen, everything else aside. But then you compound that with the medications that we're administering, the fact that we have a prolonged course of adjuvant therapy for early stage disease. To me, it's the need for better testing. There's some work in that space. I'd argue we need some more. But
anyone else want to add?
It's a really challenging problem. I had two patients in my clinic this past week who were in this situation where, their treatment kind of was dependent on these issues. And, we wind up doing the usual measurements of LH-FSH and estradiol levels, et cetera. And in one case, it was useful because it was a patient who clearly was menopausal. But in the other patient, it was not so clear. They still had levels of estrogen above what you'd like to see, for example, for selection of an aromatase inhibitor in the adjuvant setting. So it's really complicated, and these measurements have to be done serially. You can't count on just one measurement. If you start an AI on a perimenopausal patient like this, even if they have low estradiol levels, you have to check it again a couple times after starting the aromatase inhibitor to make sure that it remains in that level. So it's very tricky. We need more data on this group of patients. They're hard to study because they are less common, of course, than postmenopausal patients or even premenopausal. But it's an opportunity for research, and we need more detail in this nuanced group of patients who have fluctuating levels of hormones. And but I don't see anything right on the horizon that I'm aware of in terms of new technologies or new drugs specifically for that category. I'm just not aware of anything that's directed specifically to that problem, even though it's a significant problem.
So the last question that I'm going to pose, many people go into medically induced menopause in their 20s and early 30s. How concerned should they be about osteosporosis?
So I think osteoporosis, it's a reality. It's a consequence of chemotherapy. So patients undergo, they lose bone mass. Then when we keep them in ovarian suppression, that causes decreasing bone mass, and then they're aromatase inhibitor. So we are creating a lot of insults to the bone. Now, I think we have incredible diagnostic methods to monitor bone mineral density regularly. It's part of our job. We do that on a yearly basis. Patients need to take calcium, vitamin D, exercise. In addition, if patients have osteoporosis, we have great medications that we can give them. So I don't think that osteoporosis should be something that our patients need to be worried. I think it's something they need to be aware and then work with us to monitor, to prevent, supplement, exercise. It's of key importance. And if we see something that starts looking like requires treatment, discuss it with the physicians, because we have great medications. Of course, the last thing that we want, it's a young woman having osteoporosis and being at risk of a fracture that can be very serious. But I feel confident that we can work on that with them early on to make that not a big issue.
And if I could just throw out one other comment, reminder to our premenopausal breast cancer patients and the patients where the menopausal status is uncertain. It's healthy and obviously totally fine and safe to have a life of intimacy with your partner, but do make sure that you practice some non-hormonal contraception. I have had patients that have had to make difficult decisions because of surprise pregnancies when they're in the midst of ongoing breast cancer treatment.
Anyone else would like to weigh in?
Just with respect to bone health, I'll just echo what Mariana said. It's about awareness and about prevention. And it's not just during the course of therapy. A 20-year-old woman, we're hoping we're going to grow old together until we're 80 or 90 and above, when bone health will be an issue for all of us. And so we just have to be aware.
Well, we could probably talk for another few hours, I'm sure, because there's so much that is happening that it would be important for us to be informed and empowered at the end of the day. But I just would like to take this opportunity to say thank you. Thank you, Dr. Newman, Dr. Pegram, Dr. Liu, and Dr. Chavez-McGregor for taking time out to be with us this morning and get us excited and keep us hopeful for what the future is, following a breast cancer diagnosis. But I would just like to remind the attendees of the next activity, which is a fun round with Lindsay and Tamika. Never Have I Ever. What a scandal. And so it will be right here on the main stage. And then following that, directly, there will be the workshops that will begin at 12:15. And I just want to, again, in thanking all of the panelists, I would just like to leave our community with this thought. You may not control all the events that happen to you, but you can decide not to be reduced by them. And the great Maya Angelou shared that as one of her quotes. And all of you that know me know I'm a quotes person, and I'm always going to leave you with a quote. So I thank you very much. Have a great rest of the conference.
All right, so it looks like we are live. Everyone, welcome to Never Have I Ever, Breast Cancer Edition. We are so excited to do this with you guys today. Definitely a good way to kind of just break up some of the information that you just received from that last slide. And as survivors, we all know sometimes it can be overwhelming and we need to take some time to digest it. So I hope you do that. And if you have questions, you fall back and you ask those questions. But right now, we are going to have some fun. Woo-hoo. So my name is Tamika Bryant, and my co-host is Lindsay. We are breast cancer survivors. I am Philadelphia-based, 8-year, almost 9-year, almost on my way to that 10-year ribbon. I can't wait to get it. A triple negative breast cancer thriver, diagnosed in 2013. Basically, I received a double mastectomy. People always ask me kind of why I chose that option. My philosophy was the left was broken, the right was probably going to follow. Did I hate the process? Absolutely. Am I happy now that I've chosen it? Yes, absolutely. It was I don't want to say it was a wonderful experience, but it was a learning experience. And from it, I became a patient advocate. And it's pretty much kind of what I do today. If you guys know me out there, you've probably seen me on Instagram, Tamika Talks, where I talk a lot about breast cancer and really just engaging other people and letting them know that just because you hear those 3 words doesn't mean that life can't continue to go on. So Lindsay, I think you should introduce yourself now.
Yes, thank you, Tamika. Hi, everyone. I'm Lindsay, live from Ottawa, Canada. I'm originally a Southern California girl at heart, but my husband and I moved here for about a 3-year adventure. I'm a writer, and I also lead writing workshops for women in the breast cancer community. A little bit about my breast cancer story. I'm a 2-time cancer slayer, as I like to say. And I was diagnosed when I was 30 and then again at 32. Long time to be in and out of the hospital for 6 years, but now I am dealing with a ruptured implant, unfortunately, but I'm celebrating 3 years, no evidence of disease this year. So woohoo, yay.
That's wonderful.
Yeah. That's me. Oh, and some of you might know me because I'm on the Daily Lindsay at Instagram. And that's where I like to connect with this wonderful community.
Wonderful. So make sure you guys check her out. I checked out your page. It was really fun. I loved it.
Oh, thanks, Tamika. All right.
Do you want to tell them how we're going to play the game?
Yes. So let's get into how we're going to play Never Have I Ever. What you're going to do is I'm going to one of the hosts are going to read out a prompt. So for example, I'll say, never have I ever been the youngest person in the oncologist's office. Now, if you can answer yes, I have been the youngest person, drop a yes in the chat box, and bonus points if you share some tea about it. So we will take turns trading off the prompts, monitoring the chat and seeing what's going on. And yeah, let's have some fun.
All right. So guys, we want this to be as interactive as it possibly can. So definitely when you say your yes, give us a tip about it. And I think that example that she gave is pretty much something that a lot of us can feel. And one of the reasons why we love YSC so much, because we don't feel alone. But here's your first prompt. Let's do it. Never have I ever been told, but you look good bald. Come on, guys. Tell me. I'm certain. I can't imagine. Listen. What's so funny is I didn't even grow my hair back because it was a constant thing. And I was like, okay, I guess I can rock it. Let me keep it. I didn't wear a wig often because they made my head hot. But if I had to, I did. So come on, let us know. I'm sure we are not the only two survivors that have been told, but you look really good bald. All right, let's keep it going. So never have I ever been told everything happens for a reason. Lindsay, can you relate to that?
Totally. I mean, I know it's well-intentioned. People just don't know what to say. I've learned to just kind of say, okay, thanks, and just accept the good intentions of what they're trying to convey. How about you?
I agree. I absolutely agree. And I think that when we receive these comments and we kind of have an open mind about it, oftentimes we have to find the positive message in it. But if they catch you on a day when you're not really in a good mood, it could be a little detrimental. So come on, guys out there, let us know. I am certain that these are things that you guys have heard. We need a yes. And then tell us, give us a little example of something that has possibly happened. All right, here's our next one. Never have I ever been told, well, at least it's the good kind of cancer. Does that even exist? Is there a good kind of cancer? I remember when I was diagnosed triple negative breast cancer, of course you hear triple, you hear negative. So people are like, oh, well, this is good, right? I'm like, no, it's not good. It's not good at all. And in a lot of groups that I was in prior to me finding YSC, and I'm sharing my story, diagnosed with triple negative, there were several women in the room that were kind of like, oh, wow, that's the bad cancer. I was like, I think they're all bad, but okay, maybe it's just me. So what's your story? I'm sure someone has said that to you.
Tamika, I think we're having a little technical difficulty with the chat because I'm not seeing any chatter. It's not coming up on the screen. And I've even tried looking in the live on my phone. So why don't we just kind of keep it rolling between the two of us? And yeah, let's go on to the next prompt.
Okay. All right. So the next prompt is, never have I ever heard that breast cancer is good for a free boob job.
No one's ever said that to my face, but I know that I've heard other people say that.
So ironically, before I went for my second opinion and met with a second team, the first plastic surgeon, basically, that's pretty much what he told me. He made me wait in the office. He made me feel really, really bad. And then he came in and then he's showing me different images of the work that he's done. And he's like, well, I don't know what you're sad about. At least you're going to get a free boob job. And I said, I would have rather paid for a boob job than have gotten cancer. And after that, I was like, I'll never be back in your office again. So that's one of the other good things that I love about YSC, because it gives you the information and the tools you need to really advocate for yourself.
For sure.
This is a good one. This one is a really good one. Never have I ever watched an entire Netflix series in one day. I know. I feel like all of these are pertaining to us.
Just one?
I know, right? Yeah. That should have been it. That you've only done one. I can name so many that I have binge watched that, when it gets to the end, I'm always mad. Come on, just drop season 2 already. And I think that's part of the reason why Disney Plus only gives you one episode at a time, because they don't want us harassing them for the next season.
Sure. I probably spent more time on the couch than in my bed, to be honest, watching Netflix, just because it's more comfortable and entertainment, something to just keep your mind off all the other stuff. So yeah, definitely guilty of Netflixing marathons.
Absolutely. I mean, and it's kind of sometimes I even watch the previous one before the next season starts, just so that I can catch up on anything that I might have missed or something. So yeah, I'm a huge Netflix watcher. Yeah. All right. So let's see. This one is a good one. Literally, I just had this happen to me probably 5 minutes ago. Never have I ever had a hot flash in a public place.
I don't know what you're talking about. Hot flashes?
No, maybe they don't exist. I don't know.
Do you think my fan is big enough?
You know what? Absolutely not. I think it should be just a little bigger.
Okay.
Yes. And ironically, I think that's one of the reasons that I didn't grow my hair back, because I was like, is it going to make me hot? You know, I had the wig on. I had pretty long hair prior to treatment. And, you know, I remember all those times that I would be hot because of the hair. And I was like, you know, hair, I don't need to add to it. So I was like, yeah, maybe I should just stick with the little shortcut. But it doesn't stop me from having hot flashes, because it's literally before I got on here, I was in the midst of one and I was like, oh my God, I need water. And then I'm like, okay, no, I'm good now. Exactly. Yes. Don't leave home without it. Absolutely.
Essentials for the young breast cancer survivor.
Yes, the breast cancer survivor toolkit. All right, you're up.
All right. So let's go on to the next one. Okay. All right. My turn. Never have I ever got a tattoo. Spill.
So I actually got a ribbon not long after I was out of treatment. A lot of the tattoo places in my area give breast cancer survivors free tattoos in the month of October. Wow. And they ask for people to make donations, and the money that they receive, they usually donate it to an organization. And so that's literally, you know, kind of how I got it. I couldn't decide what I wanted. And then in the end, I was like, you know what, just give me the ribbon, put a cross through it, because it's kind of what, you know, what I expect. And I absolutely love it. And I put it inside my wrist, you know, as I'm turning my wrist or doing something, I always look at it. And it's kind of been like an extra source of strength, you know, and kind of where I came from to where I am now. So tell me about yours.
Amazing. That's awesome. I'm being a little cheeky with my answer, because the only tattoo I have is from my radiation experience. So they're just little tiny dots that they would use to line up the machine and then zap me. I have like maybe 4 or 5 sprinkled around my body. And last night in the general session chat, I heard someone say that she used one of the dots as a period for an affirmation that she had tattooed on herself. And I love that idea. And now I am like, got that stuck in my brain and like might do that.
I absolutely love that. Yeah, because you figure it's a part of the journey and, you know, you're always going to remember. And I was actually initially going to get my tattoo done up here where I have my port, where I got the port at. And I was like, you know, I don't know if I want people to always be seeing it and wanting to be talking to me about the tattoo all the time. So that's pretty much why I didn't get it. Oh, and I thought it was going to hurt an awful lot too.
Oh, okay. Yeah. Cool. Awesome. All right. So how about we get started with the next one?
Okay.
Never have I ever told someone I have cancer, and then they immediately tell me about someone they know with the same kind of cancer and all the side effects.
I think that this is written somewhere to be breast cancer 101. I really believe that, because everybody that I met, people that I know, and even like, you know, I was very vocal about my journey and kind of the process and what I was going through. And anytime I made a post about something, someone would always follow it up with, well, you know, this person had cancer and this is what they did. And sometimes it would be about stories about people who, whatever it is they did, I guess it didn't work or whatever, and they ended up passing. And so the one girl, I had to say to her, I said, if your goal is to encourage me, to tell me that what I'm doing and what somebody else is doing, and then they ended up passing, is not motivating me. So just be mindful of your words, because they have power. And I always say that to people. When you're talking to people in the midst of dealing with this, you've got to be mindful of the things that you say.
Good for you for advocating for yourself in that way, because I mean, that takes a lot of energy just to even like call someone out on that. For me, like I would just kind of be like, okay, great, good to know, like, thanks. Because the thing is, like, when you have cancer, you're kind of like a snowflake. Everyone is different. Like, yes, we all kind of are like dealing with a similar thing, but there are just so many different pathways that we go through treatment and the characteristics of the cancer we have. And so our treatment is different. But again, it's kind of like that other statement, everything happens for a reason. Like people are just trying to relate, to connect. They mean well, but like inside, it's just like, no, save it. I know you save it.
Right, absolutely.
Yeah. So, okay, how about we move on to the next? Never have I ever, had a crush on a doctor.
Nope.
Nope.
And so partly, let me say this, partly most of my doctors have been female.
That's amazing.
Yes.
I love that.
The only person that was not, and it was my plastic surgeon, who I adore. Like he is absolutely amazing. And initially I would have had a female plastic surgeon, but it just didn't work out. And I was okay with her not being a part of the team. So yeah, all of my doctors, 90% of them have been female. So
amazing. Yeah. My breast surgeon was female too. And there's really something to having someone, a medical professional who get, like a woman gets it. She had such a different approach to the plastic surgeon that I had. He was older and my oncologist, he was older. So no, like there were no crushes had or anything on my end.
Yeah. The only crush I have is on my husband, who was amazing with me throughout my journey as my co-survivor. Absolutely. Yes. Hugs and loves to him. So yeah.
Yes. Great answer. All right. Never have I ever been on a podcast, TV, or the radio.
Wow. Since social media is my thing, I've been on all of them.
Amazing.
Like I said, I run Instagram, Tamika Talks. I have a blog at Life and Pumps, and I've done countless television interviews. I've done a lot of radio just because it's easy. And more recently, I started doing a lot of podcasting, especially in the midst of the pandemic. I think like podcasting just kind of was everywhere. Everyone was like, hey, we're doing the show. Will you do this? Will you talk about this? And a big thing that everybody wanted to talk about was the amount of women who were opting not to get mammograms because of COVID. That was a really big one. Yeah,
I heard a little bit about that.
Yeah, it was a really big one.
Diagnoses were low because people weren't going out.
Yes. Yeah.
On my end, I have been on a podcast once. TV, not for cancer, and not on the radio. But yeah, social media has been my thing. Like I have, like the Daily Lindsay was my outlet throughout treatment. I wrote my way through it. Like I really believe like writing and storytelling about like our hardest, deepest, truest stories, like really helps, can be healing the emotional side of cancer. And so I have been on a podcast.
Yeah, no, I absolutely agree. Writing absolutely allows a release, and it is definitely healing. And it's something that normally when I send care packages to people that I know that have been newly diagnosed, I always include a journal, and sometimes I'll put a prompt in there just to kind of get them started. But yeah, I think, and even now, I look back on the journal writing that I did, and it's so funny to just see where I was in that moment to where I am now. So I absolutely love it. Yes.
Perspective is a beautiful thing.
It really is. My goodness. It really is.
Yeah. Awesome. I'm glad we have that in common. Oh, okay. Never have I ever secretly worn pajamas on a Zoom call. Are you doing it right now?
So here's what's so funny. If I did not have a busy morning, I would have had on my Zoom shirt and my pajama pants. Throughout this pandemic, I had like 2 Zoom shirts because, that's where that's how all the meetings were done. And initially I only had 1. And then I said, I should probably change this up before they think I don't wash this shirt. But it was great. Like I would do my Zoom calls and then I would go hang out in my backyard. So yes, I think that everybody should have at least 2 Zoom outfits because I don't feel like Zoom calls are going anywhere.
Same. And confession, I am wearing sweatpants. I've got a cute top on, but I'm wearing sweatpants.
I love it. I love it. I love it. I love it. Yes.
All right. We ready for the last one?
Yes, let's do it.
Okay. Never have I ever been in a virtual chat with hundreds of other survivors and co-survivors who get it.
Yes.
Yes.
And we definitely should, as we're wrapping up with that being our final question, we should definitely just thank YSC because they made this happen. I was so sad when we could not have the conference last year. In fact, I was actually in California when they canceled.
Me too.
So a group of us tried to get together and, do something before we all left to go home. But YSC has literally been my saving grace. Some of my very besties I met as a result of YSC. I do the bike ride. It is literally like a family. And even if I see people out and I see something that says YSC, I'm so excited. I constantly encourage other people, when they're diagnosed to join. So YSC has really just been amazing for me. And I'm so excited and so appreciative of this community.
I totally agree. The spaces they create for us to come together as a community, to relate to each other, to inform ourselves and empower ourselves. Like, shout out to the Flatty group that I was in last night, the breakout session. Oh my God, the energy in there was just incredible with women sharing their stories, and just found it so empowering. And I'm just so grateful to YSC for creating this space for us to hang out and actually doing it virtually this year. Like, how crazy is that? I love it. Thank goodness for technology.
Yes, absolutely.
Yeah. So I think that about wraps up. That was the last question. Thank you everyone for coming. We'll see you in the breakout sessions next.
Yes, absolutely. Don't forget to, I think they start at 12:15. Enjoy them. Take advantage of all that they have, and we'll see you guys soon. Bye.
Bye.
Excited about today's summit events, and I hope you are too. I'm Stacy Lewis, and I serve as your Chief Deputy Executive and Chief Program Officer. Here's what's happening for the next 30 minutes or so. Our Exhibitor Jam video will take place on the main stage. Check it out. Visit the exhibit hall. It will not disappoint. By visiting Summit exhibitors, you can claim your virtual tote bag items, shop some swag, and discover new resources. Just click Exhibit Hall at the top of the main page. Did you tell your co-survivors about the summit? It's not too late for them to register and attend the sessions and activities that are just for them. And if you're in need of some cuddle lusciousness, check out the puppy cam in the exhibit hall. But don't stay there too long. We'll see you back here in about 30 or so. Enjoy jamming with the exhibitors.
How are you improving the quality of life of young adults with breast cancer? Hi, I'm Dr. Chen. I'm a plastic and reconstructive surgeon on the YSC Council of Advisors. Breast cancer is hard at any age, but when you are young and starting out with your whole life ahead of you, it can be difficult to think that your dreams may be crushed with the removal of your breasts. When a young woman's breasts are removed to treat cancer or to reduce the risk of cancer, I do my best to recreate new natural breasts that are soft and warm and that grow and shrink as a woman gains and loses weight throughout her life. In addition, I try to restore sensation to a woman's breast so that she can feel normal. I want women to feel strong and secure. My goal is to improve the quality of life in young adults with breast cancer so that they are not defined by their disease or treatment for their disease. Ultimately, I want young adults to grow into old adults, living long, healthy, and happy lives. Second question, kittens or puppies? Puppies! Dicky!
Hi, my name is Amy and I work with Bagot. And the problem Bagot solves is, well, cancer doesn't come with a map. So we help you create one with our Take Everywhere binder that's designed to help you organize your appointments, your medical records, really any of that information that you want to keep all in one place. If you need reliable cancer information, you need coping tips, you need some support, you maybe just need questions to ask your doctor, it is all in the bag. And as to whether or not it's puppies or kitties, I'm a puppy girl all the way, although our executive director would disagree and say it's kitties, but that way we covered all. I like cats, but I'm puppies all the way. Thanks so much.
Hi, my name is Amy Hartle, and I am the creator of the As We Are Now Body Empowerment Program. This program is based on almost 9 years of my professional background as an oncology, massage, and lymphatic drainage therapist, but it's also based on my personal experience as a BRCA1 woman who grew up high risk for breast cancer and ultimately was diagnosed and went through surgery and treatment in 2017. I was lucky because I was able to take the same skills and information and knowledge that I use with my clients over the years to play an active role in my own recovery and survivorship. And that is what I have created with As We Are Now, an opportunity for you to understand your body, connect with and care for your body so that you can feel at home in your own skin. I hope you'll check it out and learn more. And if I have to pick, I guess it's puppies.
Hi there, my name is April Stearns. I am the founder of Wildfire Magazine and Writing Community. I am a 9-year breast cancer survivor. I was diagnosed at 35 and attended my first YSC summit in Austin in 2019. The whole experience was so transformative for me, and I am so excited that you are here this weekend to have the same experience. I hope you leave feeling a sense of belonging, a sense of community, just an overall sense that you're not alone and that there's hope. I hope you leave feeling stronger in your survivorship, knowing that there are people out there to help you and there are tools to help you as well. I look forward to introducing you to Wildfire Magazine and what the writing community can offer you in terms of healing. Visit me in the exhibit hall. I look forward to meeting you.
Being diagnosed at age 33 with breast cancer was life-altering, but I had my sister and my cousin right there with me who had gone through it or were going through it with me. Not everybody has that kind of support. That's why I support the Young Survival Coalition, and it's very meaningful for me to serve on the board. No person diagnosed with breast cancer should want for information or support.
Hi, my name is Dana Donofree, and I'm the founder and CEO of Ana Ono, Intimates Designed Differently for those of us that have undergone breast surgery related to our cancer diagnosis. I launched Ana Ono in 2010 after my own diagnosis of breast cancer at the age of 27, where today I'm proud to say we are boob inclusive. So if you have 2 breasts, 1 breast, no breasts, or new breasts, we definitely have something for you. I'm honored to be here as a part of YSC in the summit. Even though we're not there to hug each other in person, I can't wait to talk to you again soon. See you later.
Hello, I'm Desiree Walker, board president. I became a member of the young adult breast cancer community at the age of 38. It was a time where there was very little understanding about young adult breast cancer, its unique needs, and the services that would be required. I'm thrilled that YSC is here today for you.
Hi there. I'm John Hennessy. I'm the Vice President of the Board of Directors of the Young Survival Coalition, and I've had the privilege of working with this team for more than a decade. As I think about the summit this weekend, my wish is that all of you have an opportunity to reconnect in a way you haven't been able to for more than a year, and that you're able to enjoy the time together and learn some things and make the next year better than any of the years we've had in the past.
Hi, I'm Kristen Westbrook, founder of Calm City and co-founder of Mindset. We offer wellness and meditation programs to help reduce stress and anxiety. We also offer Mindset, a curated selection of self-care and mindfulness tools in a box. We share simple techniques and practices to help you find balance, calm, and clarity, and a great way to connect with your inner superpowers. Kittens or puppies? I say both.
I'm Megan Clearchase, Partnership Director at Grit Health. And while Grit Health was not built for any particular age group, many of us were diagnosed with cancer at a young age. I was diagnosed with breast cancer in my 30s, and I would not have made it through treatment if I had not had the support of the AYA community. It's what led me to find my voice and become a patient advocate. After all, our stories matter and our voices matter because at the end of the day, knowledge is power.
Hi everyone, my name is Pablo Colon and I'm a member of the board of directors here at YSC. Being on this board is really meaningful to me more than anything because it's my way of being able to pay it forward. When my wife Erin was diagnosed at the age of 32, YSC was an enormous resource for us and helped us with regards to really learning how to be better advocates. I learned how to be an advocate for Erin. We were dating at the time. It was an incredible resource for us. And for me, serving on this board is how I pay it forward. Thanks.
Hi, I'm Sarah, and I'm the founder of a company called Mighty and Bright, and I am also a children's book author illustrator, and I wrote this book called What Happens When Someone I Love Has Cancer. If you are like me and have kids, you know that they are your main concern when you are diagnosed with a life-threatening illness. When I was diagnosed in 2017, there was basically nothing out there to help explain cancer to kids in an honest and open way. And so I wrote this book to explain the science of cancer and how it will affect a kid's day-to-day life. And each one comes with a calendar, and it looks kind of like this. And it explains kind of how treatment's going to affect your kids and what they can expect each day. And it also comes with little buttons with activities so you can stay connected to your kids and do activities together that will not exhaust you. Puppies or kittens? I think I'm going to say puppies this time.
Hi, my name is Sarah Kleinknecht, and I'm a consultant with Beauty Counter, which is a safer skincare and cosmetic company. And what problem that Beauty Counter solves is we are so inundated with thousands of chemicals that are not regulated in our cosmetics, and Beautycounter is there to change it, whether that's making quality, safer skincare or going to DC and trying to change laws. And that's what you can learn more about Beautycounter and safer skincare. And of course, I'm a dog fan.
A cancer diagnosis is overwhelming, and as a loved one, knowing how to help can be very challenging. Our mission at Men Together is to change that. So we have created a social platform that makes it easier to give and receive with 3 free tools. We have a community journal, a gift and cash registry, and a volunteer calendar. So if you're dealing with cancer, you can get words of encouragement, healing gifts, financial support, and helping hands when you deserve and need it most.
I'm Jerry DiPiano, the CEO of Fem Pharma Consumer Healthcare. We solve the problem of vaginal and vulvar dryness, making intimacy more comfortable. Have a listen for yourself.
So appreciate your vagina today, ladies. Do it.
Hey, I'm a young survivor who experiences intimacy issues due to vaginal dryness and pain.
One solution that I'm really liking is Satisfem by Fem Pharma.
It's an excellent source of moisture to the vaginal area and tissue.
I'm in love with everything that they sell.
It is made with hyaluronic acid and vitamin E.
With the help of Fem Pharma's products, I can now enjoy sex and not avoid it.
Hi there, Holly here again. Just giving you a little micro tour of my studio through these 3 videos, but the connection that I have to the young adult cancer community. While I am not a survivor myself, it does run pretty strong in my family, so it is something that I have been acutely aware of from a very early age. And I'm just thankful that I got involved in tattooing first, and then discovered that there was such a need for this type of tattooing, so for the paramedical work. It all started with a lady that, well, a couple different very key points, but one very prominent inspiration was a younger lady that had very bad tattooing done by a plastic surgeon, and she was devastated, and she just wanted anything to cover up what he had done. And yeah, I just didn't think that was something that should be a part of a woman surviving. So yeah, it sort of just happened, and it evolved, and I'm so thankful to still be a part of the community and serve, and looking forward to helping as many people as possible, men and women alike. And yeah, also, second video, I don't know which one's gonna be picked or whichever, but still puppies. So yeah, thank you. That's Brutus and Minnie, and during the pandemic, there was lots of chalk art, so yeah, had to snag a picture of them both smiling ear to ear. So definitely puppies. Thank you.
We hope that people leave the YSC Summit feeling empowered to make smart decisions about their healthcare and well-being. We hope that everyone has a ton of fun and feels supported. We also hope that everyone continues to engage with Young Survival Coalition. You're part of our family.
We are the Foundation for Living Beauty, and our mission is to educate, uplift, and empower women with cancer. We are dedicated to improving the quality of life for women with cancer by providing wellness retreats, day retreats, educational workshops, sisterhood support events, and many other resources, all at no cost to the women that we serve. To learn more, please visit livingbeauty.org. And if we had to choose, we would choose puppies.
Hi, I'm Courtney Hagan, and as a 15-year survivor of breast cancer, I serve on the board of YSC because I am grateful for the support that this community showed me when I needed it the most, and I want to help ensure that no young person faces breast cancer alone.
Hello, my name is Haley Dinnerman, and I'm the Executive Director of the Triple Negative Breast Cancer Foundation. On our website and at our booth, you'll find information about triple negative breast cancer, as well as ways to connect to young women just like yourselves. You'll find support from our helpline and forums, and other useful information that can help you navigate your journey from diagnosis to survivorship. You'll also learn about the ongoing TNBC-specific research we support. We hope you find it helpful. Kittens or puppies? I think we're all puppy people here at the TNBC Foundation.
Hello, my name is Karen Lindsay, and I am a breast cancer survivor. During radiation, I suffered with severe radiation dermatitis. There was nothing on the market that would help heal or soothe my burning. So I formulated a special lotion that not only soothed the burning, but it healed my skin from the inside out. So please join us in our meeting group to discuss more skincare products for radiation patients. See you there.
Hi, I'm Kristen Carbone, the founder of Brilliantly. After losing my mom to metastatic breast cancer in her 40s and having a preventative mastectomy and reconstruction to avoid the same fate, I founded Brilliantly, and I've dedicated my time to helping meet the long-term quality of life issues faced by women who've had an experience with breast cancer. Brilliantly is launching our first product. It's an app-controlled warming wearable that fits into any bra for women who experience coldness after implant reconstruction.
Tiffany Green here with Casting for Recovery. Casting for Recovery provides healing fly fishing retreats for women in any stage of breast cancer treatment or recovery. The retreats are held all over the country, and best of all, they're free. That's right. We randomly select the women, and if your name is drawn, you can attend a retreat at no cost. The lodging, meals, equipment, and supplies are all provided for you. So what does fly fishing have to do with breast cancer? It just so happens that the casting motion of fly fishing is good therapy for stretching your upper body, which is especially important if you've had surgery or radiation. Plus, learning something new is super fun, and the fish live in some of the most beautiful places. For over 25 years, Casting for Recovery has been hosting these powerful, fun retreats that provide an opportunity for women to connect with nature and each other. So head on over to castingforrecovery.org to learn more and to sign up.
Hi, I'm Danielle from Triage Cancer. Triage Cancer is a national nonprofit organization that provides free education on the legal and practical issues that may impact individuals diagnosed with cancer and their caregivers through events, materials, and resources. By helping people understand these issues as they arise, we help people create proactive solutions that best fit their unique needs and circumstances. And because we're an inclusive organization, we say kittens and puppies.
Hi, I'm Jill from Side Effect Support. So what problem does Side Effect Support solve for you? We are an online resource for cancer patients, family caregivers, and healthcare providers to help reduce harmful oral side effects of treatments. We have free information, affordable over-the-counter products, access to 2 prescription products for dry mouth and mouth sores, and also teledentistry visits available 24/7, 365 days a year. As far as puppies and kitties, I would have to say if my Facebook feed indicates anything, it's got to be kitties.
Hi everyone, I am the head of engagement at Livity. We're a medical nutrition company out of Boston, and we specialize in nutrient-based solutions for cancer patients. Our specialty is the GI area, which gets impacted very frequently throughout different types of cancer treatment. So far, we have one product called Helios. Helios is a nutrient-based solution for patients who are at risk of developing oral mucositis, also known as cancer mouth sores. And it's also for patients who already have mouth sores and are struggling with eating or drinking normally.
Hi, my name is Jamil Rivers. I am the founder and CEO of the Chrysalis Initiative. We are so excited to be an exhibitor at the YSC Summit this year. The Chrysalis Initiative provides patient navigation and coaching support to women with breast cancer. We believe that the color of one's skin should not be a barrier to receiving quality cancer care. Please get to know us during the summit, and please visit us at thechrysalisinitiative.org.
Hi, my name is Melissa Eppard. I'm a breast cancer survivor and a certified life coach. And I do this work because no one really prepared me for how hard life would be after the survivor confetti was swept away. You know, treatment ends, your hair grows back, hopefully your incisions heal, and people stop asking you how you are. But inside there's still a lot to process, a lot of healing. So I help people reduce that fear, to make peace with their bodies, and to get their sexy confidence back in and out of the bedroom. So, you know, maybe you want to ask yourself, in what ways did this cancer diagnosis grow me? And who do I get to be now? I would love to help support you in asking those questions and finding answers and moving forward in life in a really meaningful way, reach out to me at melissaepardcoaching.com.
Hey, welcome back. Hope you enjoyed some time collecting swag. Coming up is the beautiful Ebony Qualls. Yes, it is belly dancing time. And there are 3 rules. 1, participate, give it a try. 2, there is no judgment allowed. If you're viewing alone, don't judge yourself. And if you're viewing with others, there's no judgment. 3, and this is a must, have a great time. And now it's time to belly dance with Ebony Qualls. You got it, Ebony.
And I am a belly dancer out of Washington, D.C. I teach both traditional and fusion style belly dance, and I'm so excited to move with you today. I'm going to teach you a shimmy and a traveling step that I hope that you'll enjoy. So first, you're going to start off with what we call basic stance. So you're going to start with your feet really close together, almost touching, but not. There is body weight back on your heels right here. So you should be able to wiggle your toes, but then just relax them on the floor. From here, you're going to soften your knees. So the knees are bent and soft. Your center of gravity is a little lower. Your weight is still back on your heels, and you're trying to line up your head, shoulders, hips, and heels in vertical alignment. Finally, you want to rotate your pelvis forward right here so that your low back is elongated and your hips point straight ahead. So this is called a neutral pelvis right here, but relax your butt. And if you're not sure if your butt is relaxed, go ahead and touch your butt. You can do that, it's your butt, and just relax your butt. From here, we're gonna roll the shoulders back and lift the rib cage up a little bit. Now, with both knees nice and bent, you're gonna practice stretching one leg out a little more than the other leg, but both knees stay bent the whole time. So you're gonna stretch the right leg and then stretch the left leg. So they're alternating. Both knees are bent. Your body weight is back on your heels. It's just that one leg is a little less bent than the other leg. So you're also trying to keep your upper body still while you do that. Now this bending and stretching with your legs is gonna send your hips up one at a time. So each hip moves vertically up and down. I'm gonna show you closely what that looks like. So right here, bending and stretching the legs. You're gonna stretch the arms out. Good. Lift your chin, relax your face, and I'm gonna put on some music for us to practice. Good. So So your body weight is on your heels, pelvis neutral, shoulders back, stretch right leg, left leg, right leg, left leg. So it's your legs doing all of the work, and your hips are merely reacting. Good, the hips move vertically up and down. This is called a hip accent. This is an accent with your hips. Now, when you speed it up a little bit, it turns into what we call a shimmy. There's so many different ways to shimmy. This is just one. So this is leg driven. Your body weight is back on your heels. Your pelvis is neutral. Shoulders back, chest lifted. And you don't need to do this on the beat. And you don't need to go fast. Just try to relax. Good. Right here. Good. Rib cage lifted, chin lifted. Relax. Keep it going. Go ahead and stretch out. Stretch out your legs. Stretch out your low back. If you feel it in your low back. Good. Whenever you need to. So it takes some getting used to. Learning how to shimmy is like learning a language. So you want to be really patient with yourself. Let's try it again. Your feet are really close together, almost touching, but not. Put your body weight back on your heels and sit yourself down so that your center of gravity is low. Knees are soft. Pelvis neutral. Try to line up your head, shoulders, hips, and heels. Relax your butt. Shoulders back. You're going to stretch out one leg at a time, alternating. And this is going to make your hips go up and down. Now make sure both of your knees are bent the whole time. It's just you're unbending one knee a little more than the other. And this pushes your hips up and down. And right, left. Now speed it up just a little bit and go at your own pace. You don't need to go fast. And you don't need to do this on the beat. This is your hip shimmy. Good. Try to lift your rib cage, lift your chin, relax your face, and breathe. Nice. Good. Keep it going. So you want to have a really relaxed feeling in the hips. Now, if you're holding a little bit of tension in your hips today, you might find that the movement comes up out of your head and out of your upper body, and that's okay. That's just an indication that you might want to breathe in through the hips and relax this area a little bit more. It takes time. It takes practice, and then it just shows up in the mail one day. So try to relax the hips, let the legs do all the work, and then stretch it out. Awesome. Let's go ahead and stretch out our quads a little bit. So grab your left shoelaces, knees together, and hold. Yes. And switch sides. Also take this opportunity to take some deep breaths. All right, so that was our hip shimmy. I'm going to introduce you to a traveling step you may have seen before. It's called a grapevine. So we're going to start by stepping the right foot back, left foot side, right foot forward, and touch. Left foot back, the right foot side, left foot forward, and touch. Double time. Step back, side, front, touch. Back, side, front, touch. Good. Now I'm sitting down low. So my center of gravity is a little bit lower. My knees are bent. Good. Step back. 2, 3. And I have my arms out, extended out in what we call low V arm position. Step back. 2, 3. Now if you want, you're going to add a little twist with the right hip. Forward, back. Now twist with the left hip. Forward, back. Twist with the right hip. Forward, back. Twist with the left hip. Forward, back. Good. Try to enjoy this. And twist. Now if you want to add something, pull the hips back and then straighten up when you twist. Pull the hips back and then stand up straight. Pull your hips back. Good, but keep your chest open. Twist, pull back. 2, 3, and twist. Pull back. 2, 3, twist. Back. 2, 3, twist. Back. 2, 3, Twist. Now, if you want to add arms, you're going to pull, twist, pull. Keep it going. Those arms are optional. You don't have to add the arms. Breathe. Extra credit if you want to smile, but you don't have to. Okay? Just keep the face relaxed. Okay, here we come with a little combo. You're going to grapevine and then sit down and shimmy. We're going to grapevine, left foot back, step back. Good, grapevine, sit down and shimmy. Good, and hold the shimmy. We're going to grapevine, left foot back, step back, right foot back, and shimmy, 8 counts. 8, 7, 6, 5, 4, grapevine, left foot, here we go. 1, 2, 3, twist, other way, sit down and shimmy for 8 counts. 2, 3, 4, 5, 6, grapevine, left foot, step back, and shimmy. Let's hold here, hold your shimmy. If you want, add shoulder rolls, right shoulder back, left shoulder back, right shoulder back. So this is what we call layering. It's when you're doing one thing with one part of your body and something else with the other part of your body, which is so good for your brain. Really good for your brain. Good. Right shoulder. Left. Right. Left. Right. Last time. Grapevine. Left foot. Grapevine. Right foot. Sit down. Hip shimmy. Add the circles with the shoulders if you want. Hold here. Grapevine. Left foot. Here we go. Step back. Right foot. Hip shimmy for 8, 7, 6, 5. Shoulders if you want. Grapevine, left foot. Grapevine, right foot. Hip shimmy, 8 counts for 8, 7, 6, 5. Right shoulder, left shoulder. Grapevine, left foot. 2, 3. Touch, back. 2, 3. Hip shimmy for 8. Shoulder rolls if you want. Last time. Step back. 2, 3. Twist, back. 2, 3. Shimmy. And relax. Shake it out. Awesome. Thank you all so much for dancing with me. I hope that felt good in your body. I hope you practice it more. Belly dancing is so good for your body and for your brain health. Please come and join me. I teach online classes, daytime classes, evening classes, weekend classes, and also a belly dance fitness. I'm offering you a 10% discount and also join my newsletter. So thank you all so much for having me. Have a great day.
Extra credit if you want to smile. I love it. That was so good. Now it's time for your workshops. There's something for everyone. So many options, but worry not. You registered, so you will have access to all the workshops for the next 30 days. You'll hear more about that before the conference ends. Now, click on the schedule or spaces found at the top of the navigation to select your workshop and attend for this time slot now. Enjoy learning, being supported, and connecting.
everybody! Hello, everybody. I just got a fun green pop-up that says I'm live, so I guess that I am. And there's two of me, which is two more of me that I wanted to see in the first place, so I'm gonna just thank you so much for being here. Welcome to the YSC Summit, Digitally Yours. So excited to be here with all of you in your bedrooms, living rooms, bathrooms. We don't judge. Can't hear you, can't see you, but we feel you. Just so you know, all of the comedians sitting up here, we do hear and see each other, trying not to look at their pretty faces and pretend that I am not distracted by their stunningness. I'll be your host, awkwardly and not awkwardly, depending on the mood. I'm Chelsea London Lloyd, she, her, and I'm thrilled to be here. And I can't wait to introduce you to this incredible lineup of people here today. My own mother has stage 4 breast cancer currently. She first was diagnosed when I was 8 and it returned 17 years later. So this organization is near and dear to my heart. We will be getting in traditional stand-up in just a moment. I'm sure some of you are like, wait, that's a moment that we may or may not need to know about. These comedians tonight, some of them have stories that are pertaining to breast cancer. Some of them do not. It is a mix, and that is wonderful. They might disclose that information, they might not, but just do know we are joined by survivors and allies alike here today. And we are so excited. I can personally vouch for all of their comedy, and I cannot wait to introduce it to you shortly. I have an official amount of time, 3 more minutes, just staring me at the face. So that's ever so exciting. Friendly reminder to the comedians, our cameras will be on the whole time, as they know. So if you have to go to the bathroom, you can't. Now, do what you please. Could be awkward. Hope you brought water bottles for drinking. Going. Who knows what will happen? There's still 2 of me. My eyes are crossing. It's a whole moment. Well, normally I'd open up and say I have 6 minutes of material and only 5 minutes on stage. So just like come find me after for the punch. Or not, there won't be an after party in my self-tape room. This is a nice backdrop. I tried to have a moment. Did it make it more professional, more uncomfortable, stiff? Who knows? But I like all of your backgrounds. We have a nice, healthy mix here of different things. A few doorways. I feel good about it. It's not a real Zoom show if there's not a few, doorways. Today I showered and then worked out, and I'm okay with that. Anybody? Okay, that's the energy I'm bringing. Yep, that's the energy I'm bringing. Shout out to those of us who left our town we were living in, moved in with our moms during the pandemic. See you, hear you, feel you, worried about you, but I'm with you. There's nothing more depressing than doing stand-up alone in your childhood bedroom, not often online and alone. My stuffed animals were like, what is this? They were just, we've seen this before, but now it's 20 years later and you're 20 times more sad. What's happening? My mic was just a permanent Claire's hairbrush. You get it. But it still happened. My stuffed animals, they were fine. American Girl dolls, though, total hoes. Hated my sets, not inspiring, not good writing partners, didn't feel connected. Like, they all had so much judgment, except for Felicity. She was chill. Owned a horse, a little pretentious, but in a chill way. And I love that for her. Helene, you look like you own Samantha, and it's showing. Maybe tone that down a little bit. We all had her, it's like not the most unique, but we still love you for you, and just tone it down a little bit. I own Samantha. It's fine. I'm not. What was up with the American Girl doll energy, though? You know what I mean? Like, my sister owned Molly, went to law school. Was it the glasses? Am I looking too much into this? Probably. Is that something I do with my time? It could be true. What do I get when I grow up? I mean, I don't own a horse. It didn't come true. I guess I said she was pretentious. Is that my truth? I don't know. What else would I like to tell you? Before we get started here, please remember that our chat bot is live. So if you would like to hype up the comedians in the chat, you can do that. It could be really exciting, could be distracting, could be the biggest mistake I've ever made, but I think it could be interesting. And if you stick around till the end, which we hope you do, it's just a short 45-minute show. We'll have a mini Q&A in the end. Next, up, we have our first comedian, Rosalie Mayu. So excited to bring her to the stage. She was a high fashion Ford model in New York and Paris before moving to LA. She is a breast cancer survivor. Rosalie, take it away.
Thank you, Chelsea. Wow. Fabulous. My dolls were headless Barbies because I had all males in my family. I don't know who else got dogs during the pandemic, but I did. And he may interrupt us any minute now. I showed up at a shelter, but it was my third shelter. It's harder to adopt a dog in LA than it is to pop out a baby. Promise. It's more complicated. I showed up and there was this solid little black 5-month-old puppy. And I said, oh my God, you guys have a puppy. Does he have a name already? And they said, yes, his name is Portillo. And I said, oh my gosh. Oh, wait a minute. I'm a white lady and I'm going to have a black dog with a Latinx name. I'm either going to get canceled or murdered on my street in Van Nuys. So I'm walking him and he's just so precious. And two painters yelled down at me from a building and said, hey lady, your dog is so cute. What's his name? And so proudly I said, Portillo. And they said, what? And I said, Portillo. And they said, shh, lady, no. I said, yes, I looked it up on Google. It means little door. And they said, no, lady, it means little back door on a hooker. Sorry. My hooker joke for the day, girls. Just thought I'd throw that out there. I'm a breast cancer survivor, vulval cancer survivor, and I didn't have many requirements. I kind of thought when I got diagnosed, I've raised the boys. I'm good. I could leave, no big deal. And then one of them got in jail, and so I knew I couldn't leave yet. I'd have to stick around a little longer in case they need bailing out. I'm a mom. That's my pronoun. So when I was going in for surgery, after 8 years, it seems, of chemo and radiation, and I was a withered little prune. And we went in to do the dastardly deed. The nurse said, is there anything I can get for you, Ms. Mayu? And I said, yes, save the nipple. And they said, what? And I said, you heard me, save the nipple. And she said, let me get your doctor. So in waddles this short little lady, and she climbs up on his step because she looks 12 and she's going to do surgery on me. And she said, what's the problem? And I said, save the nipple. And she said, oh, Miss Mayu, we are here today to save your life. We may not be able to save your nipple. It might be too dangerous. And I said, you don't save my nipple, that's going to be dangerous. And off I went. When I wake up, it's in this giant recovery room. They're the size of cafeterias and just about as sterile. And there's a priest on my left and my two sons on my right. But across the room is this nurse's station with the head nurse who yells out, we saved you. Her nipple.
Yeah.
Yep, save the nip. Let's see. I was also invited into a very special group of women that support your family for putting up with you when you're going through all this. I told the boys, I said, I was so good. And they said, you were horrible. You were difficult. All I wanted was watermelon and peanut butter. Anybody here? Watermelon, peanut butter. Dude, it's the answer to everything. And they invited me to a party, and I went to this lady's house. And I hope she's here. She opens her front door, and she's naked from from the waist up. She's naked, but not really, because they had tattooed her front. Because remember, they ask you, would you like a tattoo when they're gonna like computer measure? But she elected to get an eagle across her entire chest. It was the most beautiful thing I had ever seen. So save the Eagles. Save the Eagles, you guys. I don't know where I am time-wise, but
great. You crushed it. You nailed the 5 minutes, and I'll just be the one that chimes in. Hey, a little round of applause from 5 people. It's not awkward. It's not awkward at all.
So much fun. Thank you, Chelsea. I can't wait to hear everybody.
Thank you so much, Rosalie. It was so much fun to have you. I'm thrilled to announce our next comedian, Thenya from Kenya. She is a stand-up comedian, actress, writer, and producer born in Kenya. Yup, Thenya from Kenya. To keep it simple, she spent the first half of her life in Vancouver, BC, and at the age of 11, her family moved to Charleston, South Carolina. She's an actress out of Los Angeles. You may have seen her on Shameless, Loosely Exactly Nicole, or a Lifetime Hallmark film, The Suicide Note, and Accidentally Engaged. She's the 2019 JFL Montreal stand-up and pitch winner for her project Domesticate Me, where she garnered interest and industry connections. Look out for her on Amazon's Look out for her on Amazon's Laughed After Dark Season 3, Thenya from Kenya. Woohoo!
Oh, that was horrifying. I did not know that that's where that was going to go. I thought you just wanted that for like a pamphlet. Oh my God. Oh, that was really horrible. Anybody else have imposter syndrome? Yikes. Oh, Jesus, that was terrible. I'm sweating. My name is Thenya. I am from Kenya and I grew up in Canada, and that's why I sound nice. Okay. This isn't Get Out. All right. I will blink for you. I am safe. A lot of people ask me what it's like growing up in Canada, and I mean, just like, have you seen Drake? You know what I mean? Like, that kind of confidence only comes like in Canada. Like, I was LeBron, I was Oprah, I was their Beyonce, okay? And then I moved to Charleston, South Carolina, and I was Flavor Flav. And if you guys don't know who that is, look it up. And that's why, okay? I was basically mediocre. I recently had to unfriend somebody. I did it on the internet because I'm Canadian. I can't do it in person. So I did it on the internet. Her Instagram profile read actress, comedian, writer. Oh, my hands are disappearing. Actress, comedian, writer, abolitionist? Abolitionist? I was like, what is it that you know that I don't know? And like, also like, why is it 4th on your list? You know what I mean? I mean, I don't remember Harriet Tubman having any hobbies because she was too busy freeing slaves. You know what I'm saying? So I unfriended her. I think that dentists are disrespectful. First of all, they make you wear a bib. Like, who's the baby? Who is the baby? And then they lean you back and they scrape your teeth and they talk about you. They're like, oh, somebody missed a spot. And then they wipe it down the front of you. Like, could you imagine if your other doctors did that? Like, if your OBGYN was just like, looks like you've been playing fast and loose, and then just wiped it down the front of you. Like, that would be disrespectful. I don't know. There's no joke there. I just need us to like do something about these dentists. And if there's some of you in this audience, I'm petitioning for a better way of disposing of plaque. Okay. That's what that is. I heard a rumor about myself during quarantine. I heard that I went Hollywood and got a nose job. I was like, girl, get to know me. I would have gotten new knees, okay? I would have gotten new knees. Screw titties and an ass. I would have gotten new knees. How am I going to hold this up? Like, why can you finance ass and titties, but you can't finance knees. Like, riddle me that, okay? Um, I have been on my knees a lot recently during this quarantine. I have. Not gonna lie. Praying, guys. I've turned my life over to Jesus. I have been praying a lot because my best friend has cancer. And I shaved my head recently because I'm brave. I'm so brave. You know what I mean? I did it in solidarity, like a group of our girlfriends from high school. We all did it, even when she asked us not to. But like we all were sitting there, and what's interesting is that one of our friends in our group sat us down 3 years ago and told us that she all had diabetes, and we were all just like, we're not giving up sugar. What? But for cancer, I'm brave, you know? I was in my feelings about my friend's cancer because she's been having like a really hard time, and I'm African, so you know, like the natural thing for me to do was become a doctor, but here I am. And I was complaining to my friends, and they were just like, you know, I was like, I could have been a doctor, and they were like, oh, Thenya, listen, you're not that smart, okay? You're not cure cancer. Stay in your lane. These are interesting times, right? Like there's a lot of like things out there like racism, and like we're, you know, all filmmakers and seeing it. And it's just like, as a person of color, like I just want you to get to know me, you know, like hating me for the color of my skin is just like, it hurts. Like I would love for you to get to know me because I will give you reasons to hate me. Okay. My name is Thenya. Thank you so much. I appreciate you having me. Thank you.
Thank you so much, Thenya. I love the clap. It's like very Brady Bunch of us. We're making it work. Like, good for us. I'm so excited. That's wonderful that you shaved your head. Thank you for doing that. I also hate when people thank you for things that it's not your job to thank or say you're welcome to. I donated 12 inches of hair and gave it to cancer in the pandemic.
Yes.
And then I bought my extensions on Amazon.
Yeah. Yes. Oh my God, I bought a hair on Amazon too. They wouldn't take mine, but like, you know, no shade.
No shade. I was like, do these two things I'm doing cancel each other out? Am I selfless, worthless, just speaking my truths? Okay. Our next comedian, I'm so excited to welcome her, Helene Cornell. Helene is a realtor and actor in Los Angeles. She recently kicked cancer's butt and uses comedy to get through her darkest hours. You sure cannot break her funny bone. Please welcome up to the stage, / who's already on the stage, Helene Cornell. Woo!
Oh, thank you so much for having me, Chelsea. This is so fun. I am a cancer survivor, but do not feel bad for me. Like, I clearly like the attention. Judging from the amount of fake boobs I can feel in the audience, I felt like I was doing like a TED Talk for a porn convention, but that might be like a different chat. I don't know if I'm in the wrong place, but let me just say, if we were all on a plane together, definitely a lot of flotation devices to grab a hold to. So let me tell you a story about the time I went to the doctor, and he was like, what is your astrological sign? And I was like, I'm a Cancer. Why? And he was like, what a crazy coincidence, because you totally caught that. And I was like, oh my God, I thought you were going to say something awful, like as if I was pregnant. That would be awful. Like, kids are so gross, just like, ugh. But, you know, when you're like facing your mortality, you're willing to do a lot of things, like NBA players. And people kept sending me thoughts and prayers. But what I really want is body shots with NBA players. What I realized is like having cancer is like the open bar of hospitality. Like, I have been shoplifting in plain sight. I hit a guy. I only got a fix-it ticket. And you guys, I took up 2 handicapped spots for a Zoom show. I'm just like, whatever, doing it. It's also a really great way to get out of obligations. Like, my friend's like, can you pick me up at LAX? I'm like, no, cancer, can't do it. She's like, can you please buy my kids Girl Scouts cookies? Absolutely not. Cancer feeds off of sugar cells. Can't do it. And she's like, Helene, can you please split the bill with me? I'm like, last time I checked, you didn't contribute to my GoFundMe. And I'm hearing you pray for me, but I really want to hear you pay for me. So if you could just pick it up, that would be great. Question, do you guys know what the keto diet is?
Yeah.
Okay. So I am on a great new diet. I've lost 237 pounds this week. It's called the chemo diet. It's great if you're on a budget. But what I didn't know is I lost all of my hair, and for the first time in 30 years, the carpet matched the drapes. I have been getting a lot of backhanded compliments. Like someone was like, you don't look sick. I was like, well, what do you want me to look like? Tom Hanks from Philadelphia? Because that's not even the right disease. One of my girlfriends was like, you look just like Ellen DeGeneres, but with less money and fake boobs. Have you guys ever been in a crippling amount of medical debt and been forced to sell things online? Like pictures of your feet? No? Okay. Well, you can't see neuropathy in feet pictures. My ex-boyfriend, Mark Johnson, 717 North Vineland Avenue. He asked me, are you excited to get a boob job? And I was like, no, Mark, I'm just excited one of us is getting a job. Do you know what phantom limb syndrome is? Do you know? Okay, so it's like when you remove something, you still feel, well, like I still feel like the ghost of my experimental college days in the middle of the night. When I went under, my doctor decided to give me a complimentary upgrade. So I woke up with, to match my grade point average, I now have a D-. I decided to go the holistic approach, and I'm shopping at Whole Foods. So I went through the teller and I got cheese strips, orange juice, and diapers. And the guy ringing me up was like, oh my God, do you have kids? And I was like, ew, gross. No, why would you say that? And he's like, oh, because you have throw up on yourself. And I was like, no, that's just the cancer. I got one more joke for you at Helene Cornell. I'm doing the whole New Age approach, and I joined a drum circle at my cancer support center. And one girl got a triangle, one person got a tambourine, I got a drum, and I was so off rhythm, and I just couldn't figure it out, and I was just like completely off rhythm, which reminded me a lot of my last threesome. I don't know if you guys can relate to that, but please follow me on IG. Thanks for having me. Chelsea, you're the best.
Oh, thank you so much, Helene. That was awesome. Helene and I met last year before the pandemic, and it's so cool to connect with you virtually. So thank you so much, Helene. We have a question in the chat. I realize it's another chat, and then there's a chat feeding to this chat. So the question is, what is the craziest thing that happened to you during a live set? To be quick, before the pandemic, during a live set, an audience member stood up to me and said, hey, I'm friends with your dad. Just in the middle of my set. And I was like, do I entertain this? Like, God, like what's going on? Normally it's normal as hecklers, you kind of move on. But I was genuinely curious. And I was like, really? Tell me more. And he's like, yeah, we go to Baskin Robbins together every week and talk about our kids. My dad died in 2010, so I wasn't sure how to respond to that one, but shout out to that guy. This is not a punchline. That's just a moment. That happened. So crazy things happen. I'm sure you guys have really good stories too. If any of the other comedians want to put in the chat something crazy that's happened to them, I will read it at the next break. So excited to bring up Esther Chen. Esther Chen learned English from watching The Sound of Music. She's a stand-up comedian and actor from Taiwan. It can be seen on HBO, Hulu, Amazon, FX, BuzzFeed, and MTV. Esther Chen, thank you for being here.
Hey, oh my gosh, wow. You can also check me out on Pornhub. There's a category for girls with bangs. It's very popular. If you're looking to start, it's open. I am the only person in my family with a master's degree.
Hey.
Everybody else has a PhD. Yes, I did learn English from watching The Sound of Music, because my parents are cheap. But listen, it totally worked. My very first words were, "The Nazis are here." I, I was a middle school teacher in New York City, but I recently found out that apparently, like a lot of my kids were having sex in the school stairway, which I guess makes sense because the boys haven't grown tall enough to reach the girls, so a step helps. But it did also make me wonder, like how do they make it happen? Were they just like passing notes in my class? Like Miss Chen is so boring. Let's fuck. Right now I am in Taipei, so good morning. Good morning. It's bright and sunny. I'm in my childhood bedroom. Yes, living with my parents, the dream. I was based in New York City, but a year ago I was on the subway. I cleared my throat, and this guy, started yelling at me. And he was like, "Go back to your own country." And I was like, "Oh my God, he thinks Taiwan is a country." So I went back to my own country. No, but truly, I made this decision when I was walking down the streets of Chelsea, Manhattan, and this guy, he started spraying me with Febreze. So I was like, all right, I'm leaving. And so I got on the plane. I got to the airport here in Taipei, and my parents spray me with Febreze. For the longest time, I did not date Asian guys because Asian guys think I'm like way too opinionated. You see, like white guys think I'm like, oh, sassy and spunky, and Asian guys think I'm their mom. It's really tricky being an Asian girl in America because, if you speak up, people are like, oh, she's so pushy. And if you don't speak up, they're like, oh, she's so submissive. If you do, and if you just do neither and stay active, lesbian. See, in Taiwan, if you speak up, men will be like, oh, she's so bossy. But if you don't talk at all, Taiwanese men will say, will you marry me? So, I'm a virgin. Oh my God, thank you! Thank you! I could have done this without you. Thank you. Thank you. I like to thank God and my mother and a very strict upbringing. I don't love talking about my virginity, but I do feel like I gotta talk about it in case tonight I accidentally fuck somebody. Yeah, see, growing up in my family, we don't talk about sex. Nuh-uh. Like one time I asked my mom about sex, she almost evaporated. I was told that Taiwanese women are expected to be virgins before marriage, and that's a really big sacrifice, right? Because that's like no biking, no horseback riding, no Six Flags, right? Because then you go gone. But Taiwanese men are expected to have experience. So I figured single Taiwanese men must be having sex with each other. Or with one very busy woman. Listen, it's unrealistic, right? I have thought about losing my virginity, but I figure, I've held on to it for so long. I don't know, might be worth something, right? On eBay. Like a Beanie Baby, right? Yeah, or its value could drop rapidly, like a Beanie Baby. I mean, what does the diamond go for these days, huh? Because listen, I am in mint condition, all right? Like my box is still in the box. But the truth is, the stakes have gotten very high for the guy who's going to take it. Because listen, at this age, you break it, you buy it. No refunds. All right, thank you.
Thank you so much, Esther. This is so fun. I'm having a blast. We have 2 more comedians. Please stick around. I mean, stick around. You could leave. I wouldn't know. Who am I to judge? But please, we're so happy to have them. And if you have more questions, you can put those in the chat that you guys are seeing on the live audience side. We would love to answer those at the end. And please, if you have a specific comedian you'd like to ask a question to, please indicate that. And if not, I will choose at random. So keep those questions coming and we'll just do a few Q&A moments at the end. Our next comedian, so excited to welcome Keitra Long. She is a stand-up comedian, actress, writer, and producer from Birmingham, Alabama. She's appeared on Freeform, Showtime, BET, Comedy Central, and you can find her streaming services, including Netflix and Amazon Prime, and Laughed After Dark, where she recently made her stand-up comedic debut. Welcome!
Oh, that's it? There's just, okay, you just cut it off there? Because I
just an awkward transition for no reason. Yeah, it's just like whatever happens, happens.
I know I have a lot more credits. I need you to say that. don't be short of mine. People might be surprised by what they did, but I deserve what I got. Come on now. It's like, hey y'all, I'm glad you got my name right though, because of course you guys, my name is Keitra. That's Ketra. A lot of people see that on paper and mess that up. They call me Ketra, Kenra Tantra. Last week somebody called me Karate. That's not my name. I've been doing comedy for a while. I got this one homeboy the other day. He called me Ketra. I'm like, yo, my man, why you call me Ketra when you know my name is Keitra? He said, cause your mama dumb. Your name is Ketra. Everybody knows you need the E to E out or the EY sound to make the long E sound. Everybody knows that. If it's not, name one word that's preceded by a consonant followed by a vowel that makes the long E sound. I was like, oh shit, maybe my mama is dumb. 2 weeks, but I called him back at 3:00 in the morning. I said zebra, bitch, and I just hung up the phone. Y'all, I am 5 years cancer free. Yeah, everybody, 5 years cancer free. I just started talking about it on stage recently, and a lot of comedians, they'll come up to me and they'll be like, oh my God, Keitra, we didn't know you had cancer. And I gotta say, that's because you're not my friend, bitch. They just want to know. The hardest part about surviving cancer, I thought it was gonna be actually surviving cancer or beating the cancer, but it was surviving my black ass family. That's the hardest part about cancer. Black people do not know how to handle illness. They just don't. My sister got a little habit, okay? She got a little habit. She came in my recovery room after my surgery, and she just started talking to me loud. Now, I had breast cancer. Wasn't nothing wrong with my hearing. She came, hey, sister! I know this probably might not be a good time, but when they give you them pills they gonna give you for cancer. Can I buy some off you? No. That's why they give you that many so you can share. We can go into business. I can sell some for you, and I can save some for me. Get out of here. Then the doctor came in. She started talking to him loud too. He was like, Miss Long, we gonna give you Tylenol for the pain. She was like, good. Can you give her the 800 milligrams? Because they banned me from Rite Aid. It's embarrassing. My father tried to out-cancer me. I tell you, let me just to preface that. Me and my father have a very tumultuous relationship. My father think I'm a lesbian because somebody told him I remind him of Wanda Sykes. That's how tumultuous our relationship is. He called me one day. Sharon down there at the job said you remind her of that Wanda Sykes. Now I know you're funny, you're telling them jokes and all, but are you funny? Okay, you can tell me, girl, when you're hungry, you gotta eat. Now I get it because let's eat. Okay, never mind. My dad tried to out-cancer me though. He called me when I went into remission, and he was like, "Oh, baby girl, they say I got the cancer too." Like, oh my God, how you know, Daddy? I've been coughing. They say it's contagious and I got it from you. Well, what kind of cancer you got, Daddy? He said, ovarian.
Oh, he did not.
So you know what, Dad? I can see that. She ain't nothing but a little bitch. I got a bitch ass daddy. That's what I got. I want to end with I thought I was gonna be a better person after I got cancer. Nope. I thought I was gonna like run a marathon every year, volunteer, climb a mountain, sip tea, and light incense with Erica Badu and shit. Ain't none of that happened. I'm a worse person than I was before. Look, let me tell you, my friend just had the ugliest baby I ever seen in my life. And she be trying to do cute baby stuff like that's really not her forte. And the other day she called me and she was like, Auntie, I want to be Beyonce. I was like, come here, sit down, let me talk to you. You're not Beyonce. As a matter of fact, you're not even Solange, and that's hard not to be able to be. You could be Jay-Z. That's who you could be. 16 bars. That's what I need you to do. Well, that's been my time. Hey, make sure y'all follow me on social media at Ketra Long, Ketra Long. Make sure you do that for me. It's the only way I'm gonna survive.
Woo! Love it. Thank you so much, Ketra. I was like, just had a moment. I was like, what if I mimicked bringing you up on stage and like had a mic and like came up with it? It could have been a whole moment. We'll never know. It's in the past and maybe next time. Okay. I'm so excited. Last reminder, please put your questions in the chat that you guys are seeing on your screen. YSC will then wire them over to me and I will do the quick Q&A at the end. Don't be shy. Please feel free to ask anyone up here anything that you would like. I didn't ask them full permission, so if they're embarrassed, then it'll be a fun moment for all of us, but we would love to hear from you. And now to bring up our headliner, we have the incredible Liz Glazer. Liz Glazer is a stand-up comedian, actor, and writer who used to be a tenured law professor, a job she was very funny at. Liz recently won first place in the Boston Comedy Central and in the Boston Comedy Festival. And just this March, there was an article about her in comedy in the Wall Street Journal. During the pandemic, Liz has been doing stand-up, aka yelling into her laptop on Zoom. Welcome, Liz.
Hi, thank you. Okay, well, it is Zoom, but I got a question, okay, about Zoom. Like, we've been on it a year plus. Have we gotten confirmation that it's pronounced Zoom and not Zoom? Just a question, okay? I'm not trying to divide a Zoom here, but the thing is, it's like we've been isolated. I mean, now not, but it's been a while, for like a year. Like, I think it's like what if it's like the book that you read over summer vacation, and while you're reading it, you think you're saying the words right, and it's not until the first day of school you got to pretend you were saying them right all summer, but you weren't. Like, you come to school, you're like, oh yeah, I totally knew her name wasn't Hermione, right? They definitely didn't serve hors d'oeuvres while reviewing the dossier. What? She crotcheted a blanket. That's what it said. Like, I got my vaccine. The pandemic is over, at least here, right? What if it's Zoom? Truly, we're out of quarantine at this point. I say Zoom. That's the thing, okay? I think I would be a very good spokeswoman for Zoom. I married my wife on Zoom, okay? I am a lesbian. Just ask Ketra's father. No, I am. I feel like at some point I did get gay enough. I could stop coming out. People were like, we're aware. But I wonder sometimes, what kind of lesbian am I? It's like there's a lot of types, and are you a good, bad, whatever, typical? I think in some ways I'm a typical lesbian. I have cats, okay? So that's you got me, right? I have 200,000. We all live together in a U-Haul. It's parked right outside my ex-girlfriend's house. She lives there with my other ex-girlfriend. They're together now. I park behind the Subaru unless it's being used. Then I'll just park behind the other Subaru. But I don't know if I fit into the stereotypes. I'm bad at sports. Okay, there I said it. I am bad at sports. I'm so unathletic, and I think I'm the worst kind of bad at sports because I look like I might be good at sports. So what happens is I get drafted for teams for sports, only to get kicked off of the teams immediately for having no clue how to sports. Like, I was on a basketball team at my law firm, no less, okay? I was the worst player on the law firm basketball team. You know how bad you have to be the worst lawyer on a basketball team? I got the ball one time the entire season, which, like, I think we can agree that that was an accident. And I'm just like standing there petrified, like, what do I do with this ball? And then I'm like, oh, I know, I will pass the ball to the referee. So that's the kind of lesbian I am. Like, just truly, truly bad. I mean, I was a lawyer. I used to be Alice from the Brady Bunch. No, I'm just kidding. I used to be a law professor. That was what Alice did. She didn't get much of a backstory. But no, I was a law professor. People are like, why did you go to law school? I'm like, I'm setting up some jokes I'm going to tell in approximately 14 years. I'm a planner, you know? But, like, truly, I mean, people are like, you know, my dad used to say, nobody can take your education from you. And I'm like, does anyone want it? If you want that, I'd recommend a lot of Adderall. But anyway, I got into stand-up in the typical manner, right? I mean, everybody does this. It's a tired story. You've heard it a million times. But, like, you know, to get into stand-up comedy, what do? You go to law school for 3 years. Then you practice for 2 years. Then you teach for 9 years, get tenure, and then give it all up and do stand-up comedy. Yelling into your laptop in front of the bathroom with the cat litter on Zoom. This is living the dream. It's my mother's nightmare. No, truly, she was like, Elizabeth, what are you going to do to make money? And I go by Liz, but it's like she paid for every letter, and vowels are expensive. She's like, Elizabeth, what are you going to do for money? And I thought I was being clever. I was like, well, I could prostitute. And she was like, oh, really? Which, like, I do think she has a point with the sick burn, right? Because I'm like, what kind of prostitute would I be? I'd be in a sweatsuit right outside of my house if somebody came by. They'd be like, you want to have sex? I'm like, are you serious? Let's just go to your house. We'll talk all night. We'll start a podcast. That's the kind of prostitute that I think I would be. Just a little something different, a very particular experience. I'd be like an artisanal prostitute, I think, you know? So anyway, that's me. But, like, I did have a thing with, I have not had breast cancer. Thankfully, I mean, I was like, I didn't. But I did get a mammogram that required a biopsy. And so, I have the utmost respect for people who have had other experiences and people who know people who have had other experiences. And that is not a joke. That's just a moment of sincerity from my heart. And I really, like, my heart goes out to you, as do my breasts. And that's just the lesbian in me. But anyway, so it was actually, like, during the pandemic, okay? And, like, I don't know if it was just me during this whole time, but, like, during the pandemic, I could not sleep. Was anyone with me on that? It's gotten a little bit better, but, like, my insomnia was out of control. It was like I was in law school during finals, okay? Just, like, nothing worked. I tried everything to go to bed during the pandemic. I tried Benadryl. I tried melatonin. Every night I went to bed dreaming of literal anesthesia. How many melatonin equal anesthesia? Truly. And, like, true story, I went to get a biopsy during the pandemic, and I got local anesthesia, okay? But it knocked me out completely unconscious. It wasn't supposed to, but it did. And after I was like unconscious for 15 seconds, and I wake up and I have the doctor and the nurse on top of me, and my first thought was, why am I awake right now? That was the best nap I had since March of 2020. I want to do it again, right? But the thing is, the other thing is, in light of, this was all in the same thing with the biopsy and whatever. So because of my background, I don't trust people who have regular jobs who are too funny, because I know where it leads, okay? And so if you're a chiropractor talking about, oh, you want to go to an open mic, get your hands off my back. That's what I got to say. And so I went to this breast doctor, and she's dropping bombs, and not like cheesy jokes. You know, she's not doing dad jokes or mom jokes. She's like, I'm like, you know, inadvertently just finding myself like wanting to be her best friend, her number one fan. I want to be at the Netflix taping. And she's just like dropping them. I'm like, she's hilarious. I don't want her to be my breast doctor. Okay. And the thing is, but I kept having to check myself because I was liking her so much in spite of myself. And then she drops this. She's like, sometimes, Liz, I cannot even tell my right from my left. And I was like, I know, me too. You do this, but then like, what's an L? And we're having the time of our lives. And then all of a sudden I stop myself and I'm like, maybe the person who's going to tell me if I possibly have cancer in one of two breasts should not lead with telling me she doesn't know her right from her left. So that's what I got to say about that. But anyway, she ended up actually not being the breast doctor. She actually has a special coming out on Netflix. We're touring together. We're best friends. She's amazing. Anyway, no, I've been actually, like, my wife and I, so we got married on Zoom, okay? And I really have had, like, a lot of things happen on Zoom to me. My dad died, not on Zoom, but what a show that would be. And I'm sorry, I don't mean to, like, bring up my dead dad. I know it makes you all sad because you all miss my dad. But, like, honestly, no, it's like the thing about grief is that it seeps in to like regular moments, especially like fun moments. And so for Memorial Day weekend, like we're trying to make plans with my family. And one of the things that I've noticed is that whenever we're like planning a birthday or a holiday, one of the members of my family will be like, oh yeah, well we could go, here, there, the other place, we could have a party or whatever now that the pandemic is done. And then somebody will be like, does anyone want to go to the cemetery? And then that's what we do to celebrate. So I was wondering, I was like, what are we going to do for Memorial Day weekend? And my mother, I was like, maybe we could have a barbecue. And she's like, we could, and have Daddy's unveiling. So that's what's going to happen for our Memorial Day weekend. Anyway, but I did also get married on Zoom, just for a lighter note. I married my wife on Zoom. She is a rabbi. I don't know what you're thinking in terms of female rabbis, but like, I don't like braid her long beard every night before bed. It's a mustache. She's reform. But like, truly, I mean, when I came out, my parents were really not thrilled. They were like, Elizabeth, what are you thinking? Being a lesbian? What are we going to tell everybody at shul if you're a lesbian? And then I start dating a rabbi. They're like, hold on, we're proud, So, I mean, we got married on Zoom. We walked down the aisle to hold music. We served a sourdough challah we made ourselves. I wore this. And, the thing is, it's like my wife wanted a big wedding. I apparently wanted a pandemic because, like, a Zoom wedding was my dream wedding. Honestly. I mean, it was, like, so easy. It was so chill. It was the best. But anyway, so we're trying to have a baby, which it's basically my wife and sperm donor 15903, but I will happily raise their babies. And, so we're having a lot of sex. No, I'm just kidding. It's like mostly doctor's appointments where we have sex. Just kidding. It's making out with the gynecologist. But anyway, no, I think it's funny because we had, because of the pandemic, we had these like gynecologist appointments that were like not together, but right next to each other, which I think is so hilarious because it's exactly what I imagine a straight guy would think that lesbians do together. Like, oh, what do you just like take each other to the gynecologist? It's like, yeah, actually, we had 1 and 1:30 back-to-back appointments, practically foreplay. But the thing is, it's like you don't know a lot of things in a lesbian relationship, right? Like, it's like, for example, who takes whose name? Okay, so my wife happens to be named Karen. That's her maiden name. But now, it's a tough time to be a Karen. Everybody knows that, right? And the thing is, the people who are gonna be the first to tell you that are the Karens. They hate it the most. They're like, who can I call to get rid of my name? So for us, because it's a lesbian couple, my wife, we're now both the Liz's. You know what I mean? So that's how we took care of that. But the thing is, it wasn't clear who of us was going to be the pregnant one, right? There's no rule book on that. And so we went to the gynecologist. And again, we had to go separately, but at roughly the same time. And so after the appointment, I asked my wife, I was like, how was your gynecologist appointment? And she said, normal stuff, like about she happens to have a hospitable uterus. I'm not bragging, I'm just saying, she answered with like how likely it would be for her to get pregnant. Then she asks me, she's like, and how was your gynecologist appointment? And I proceeded to tell her which of my jokes worked on which of the nurses. So I feel like if you're deciding between two lesbians who should be the pregnant one, the answer is not me. I was like, I'm half vaxxed, but it's on my mom's side, so it counts. They loved it. No, the breast doctor's jokes were way better. But anyway, no, I wanted to just answer the question just to get out of here on that, because you asked about the worst experiences on stage. Here's something. Okay, so I was like, for me, whenever I'm nervous that something is like, it has to go well, then it's not going to go well. That's like a rule for me. And so I was on this show, and it was a largely Mexican Catholic audience. And as a result, I decided, because I really wanted it to go well, that it made sense to describe to this audience the difference between Reform, Conservative, and Orthodox Judaism. They needed to know. Meanwhile, they're going like, okay, and like, it's just the worst set of all time. You could hear a pin drop, and in the middle of the set, somebody's phone accidentally heckled me, like someone's Siri on their phone goes off in the middle of this TED Talk on Judaism for Mexicans. In the middle, there's someone's Siri on their phone goes, I'm sorry, I didn't quite get that. And that got the biggest laugh of the entire set. So that's my worst experience on stage. You all have been amazing. I have loved this Zoom. I so appreciate everything that you're doing. Thank you so much for having me. I'm Liz Glazer.
Woo! Thank you so much, Liz. That was incredible. So many brilliant things there. I love that you were a lawyer. That's fantastic. My little sister just graduated from Columbia Law School, but I ordered 16 wigs on Amazon last week. So I think we're on the same page.
Congrats.
She's scored the 98th
Both of you.
percentile on her LSAT. I'm in the 2% of female comedians. So together we're at 100%. Okay. Thank you for being here. You guys, this was an incredible show. We are so honored that you were all here with us virtually. I know it's not as sexy as in person, but it was a true blast. We have time for a very short Q&A. We know Liz is headlining another show. So Liz, you'll be automatically swapped at the time in just a few minutes. And we'll probably just go 2 or 3 over that. So you guys will all be out of here shortly. I'm going to ask you a few questions in the chat, and then we'll have you go back to your evenings. So I'm going to just do my little snooping here and see what I was sent to by the lovely YSC folks. If you have another question, now's a great time. Okay, question from the audience. What made you guys say yes to performing tonight? We'll do this popcorn style, try and keep your answers brief so everyone can go. But if anyone, and you don't all have to answer them, but what made someone say yes?
Addiction.
Yes, love that. Pretty much. Anyone else want to chime into that one?
Quarantine.
Quarantine. Yes, survival, addiction, quarantine. Now we're just saying words. I'm going to go to the next question. For those of you who had a cancer diagnosis, did you start doing your comedy after, or is it something you've always done? Anyone who wants to take the floor can.
After. Definitely after, because I had a nice career and then I couldn't make anything serious ever again. It was like, no, it's ridiculous. And so I'm going to stay here.
Love that.
I was before, but I was bad before, and I was like, God did me a favor. God, he wanted better for me. God knows best. Like, listen, I'm gonna get you where you got to go.
Love it. Okay, I'm going to ask the next question. Are any of you performing live again? If so, how's it going? If not, what are you looking forward to about being live?
Yeah.
I can say something if that's okay.
Yeah.
I actually built a stage in my backyard so that we can be outdoors and do comedy outside. So we'll find a way to put it online, and then, yeah, it'll be awesome.
Amazing. Anyone else?
I am performing live. I actually just opened up a comedy space on Melrose. It's called the Comedy Nook. So I am, I'm in it.
Yeah.
Me
incredible space. Huge congratulations. I've been there. I was there yesterday with the host, Chelsea. She was awesome.
Yeah, congrats, Thenya. That's amazing. And Helene, that's awesome about your backyard as well. I started performing live right when I got my 2 weeks post-vax. I'm in New York, and so I perform there, but I've gone, pretty much fully back in. I still do a lot of Zoom, but now it's kind of like a hybrid, Zoom and perform lifestyle.
Yeah, I just got back from Vegas, and it doesn't know that there was ever a pandemic. No, that's not true. It is cut down the size of audiences, and everybody kind of wears their mask until they get up and spit in the mic.
Right.
Yeah.
Makes sense. Perfect sense.
A lot of shows are having mic condoms now. You put this plastic or mesh thing over your condom, over your mic. Every single person makes a bad condom joke. The guys always pretend like they don't know how to do it. Happens every time. And there you go.
Mental dam.
I'm going to just say goodbye because I think they're putting up a slide, but this was amazing. Everybody was so great. Thank you for having me. Sorry to leave before. I don't think I press that I'm leaving.
They're gonna swoop you out.
I'm very afraid to do anything. I'll just be honest about that.
Yeah. Thank you to YSC for being so organized. Thank you so much for Liz for headlining.
And yeah. Thank you for having me.
You're incredible, and she's jumping to her next show on Zoom during the pandemic.
Yep.
The rest of us just have a couple more minutes here. I'm just gonna ask one or two more questions. Let's see what else we have here. What is your favorite show you've ever done, or favorite comedic memory?
I did a show when I was completely bald going through chemo on my birthday, and I guilted all of my friends to come and watch me, and I was running the light, and I remember saying, "You don't get to run my light, I'm pulling the cancer card," and I just closed it out. So people stood up. It was like one of the best moments of my life. Immediately did some whiskey shots and shit my pants, but it was worth it.
Amazing. We have time for like one more quick story. Anyone?
Oh, I mean, I don't know how to top that. It was like, yeah, I was like, I don't know how to top that. I followed Judd Apatow at the Comedy Store once, and I was like, actually, you know what? I followed Whitney Cummings once, and I was terrified. That was actually really terrifying. And I actually still maintained the room, and that was just really like shocking to me because she's incredible and just So yeah, that was probably one of my best moments.
That is amazing. I'm so sorry to cut you off. We have a 26-second countdown. Thank you, everyone, for being here. Please DM these comedians on Instagram. So much to them. It was wonderful to have you. Anyone grieving, I host the Dying of Laughter podcast, a comedic take on grief. All of these comedians have wonderful things as well. Follow them. Thank you, YSC. This was so much fun, and we'll hope to see you next year in person. Bye.
Bye.
I think